The K-9 wouldn't let anyone touch the wounded Marine general. Not the trauma surgeon. Not security. Not even the nurses rushing in with blood and scissors. In a Reno emergency room under hard fluorescent lights, a German shepherd named Gunnar drew a 6-foot line around the gurney and dared the world to cross it. The monitor tones slowed. The general's pulse thinned. And every second, the staff argued a man who'd survived war started losing a fight. He shouldn't have to lose on a hospital floor. Then a brand new nurse stepped out of the crowd and spoke a secret unit code. The dog sat. If you've ever felt invisible at work, judged before you're understood or punished for doing the right thing, stay with me. By the end, you'll see how one decision can save a life and expose a truth no policy can contain. Like the video and comment where you're watching from. The room had gone still after the dog obeyed, and that kind of silence does not happen in an emergency department unless something deeper than fear just took command. 7 days earlier, Crescent Valley Medical Center was ordinary in the way hospitals have to be. The doors opened, the triage desk filled the waiting room, complained about time, and the air carried the same clean chemical bite that clung to scrubs long after a shift ended. Outside, Reno moved through its own rhythms, neon and headlights, and late-night hunger, while inside the ER lived in a steady cycle of pain that never made the news. Claire Maddox arrived before sunrise on her first day. She walked in with damp hair from a hurried shower and a badge still stiff from the printer. Her scrubs were pressed too clean as if she had ironed them with care that bordered on discipline. She did not drift into the nurse's station with a bright voice or a nervous laugh. She stopped at the edge of the room and waited. Hands relaxed at her sides, posture straight enough to look accidental, quiet enough to disappear. Charge nurse Tina Wu looked up from a clipboard and gave her a quick once-over. Tina had the kind of face that could soften for grieving families and harden for chaos without changing shape. "You Maddox?" Tina asked. "Yes, ma'am," Claire said. Tina's pen paused. "We do not do ma'am here." Claire blinked once, then nodded like a correction she had expected. "Yes. Sorry. Yes, Tina." That was the first moment anyone noticed something about her. Not what she said, but how she accepted the adjustment. No bruised pride, no excuses, no story. Just a clean pivot. Human Resources had filed her folder with dozens of others. Nursing degree active license clinic work in Northern California, references that said competent steady shows up. The timeline looked neat. Too neat in a way that HR never punished. The kind of neat that makes administrators sigh in relief. Orientation was a blur of hallways and codes and supply rooms, yet Claire moved through it like she was mapping terrain rather than learning a building. When Tina pointed out where crash carts were kept, Claire's eyes flicked to each location and stayed there a beat longer than necessary. When a preceptor mentioned the security exits, Claire did not nod politely and forget. She turned her head and looked as if she needed to confirm every path with her own eyes. Her assigned preceptor for the week was Jamal Price, an ER nurse with a warm voice and tired humor. He had worked Crescent Valley long enough to recognize the difference between anxious new hires and dangerous ones. So Jamal said, walking her past trauma rooms and supply bays, "What's your story?" Claire adjusted her badge clip once, then let her hand fall away. "I do not really have one. Everyone has one," Jamal said. Reno is not exactly the place people stumble into by accident. She smiled polite, distant. Fresh start. It sounded rehearsed, but not fake. More like a phrase she had used until it lost its edges. Jamal raised an eyebrow. That is the kind of answer that makes people ask more questions. Claire's smile did not change. It also makes people stop asking. He let it go. He had learned the hard way that hospitals were full of people carrying something heavy. Sometimes the kindest thing was to let them carry it without grabbing. The ER threw its first test at her before her second cup of coffee. A motorcyclist came in with road rash, a cracked helmet, and a leg bent at an angle legs were not built to take. The patient's friends crowded the doors, shouting, shaking with adrenaline and guilt. The resident at triage stumbled over orders, trying to sound calm, while his hands searched for competence. Jamal watched Claire closely. New nurses often flinched at exposed bone or froze when pain turned loud. Claire did neither. She moved to the bedside, gloved hands, steady eyes focused on the patient's face more than the injury. She spoke in a low voice, not soothing, not dramatic, just clear. "Hey, look at me. Tell me your name." The patient's eyes flicked toward her, wild and wet. "Tyler. Tyler, you're in the hospital. We're going to get you pain medicine. Breathe slow with me." Her own breathing slowed first, like she was setting a pace he could follow. Tyler's shoulders trembled, then began to match her rhythm. Jamal stepped closer, pretending to check the IV supplies, really checking her. "You've done this before," he said quietly. Claire did not look up. "I've taken care of people who were scared." That was all she offered. It was not a lie. It also was not the full truth. The day rolled on. A toddler with croup wheezing and panicked clinging to a mother whose mascara ran in black tracks down her cheeks. A man with chest pain that turned out to be reflux and fear, not a heart attack. A teenager brought in by police after an overdose, her wrists covered in faint white scars like old lightning. Claire worked the rooms with the same calm, as if every crisis belonged to the job, and none of it belonged to her heart. She charted quickly. She asked the right questions without drowning patients in them. She anticipated the small needs that keep care from collapsing a fresh vomit bag. Before the nausea fully arrives, an extra blanket. Before the shivering becomes a fight. A quiet explanation offered to a family member standing too close to the edge. When someone cried, she did not recoil. She did not rush to fix the crying with words. She stood there steady, as if she understood that sometimes the only thing a person needed was another person who did not break. Near the end of her shift, a metal tray clattered to the floor behind her. It was loud, sudden, ugly. Several nurses jumped. One resident cursed under his breath. Claire turned first. Not with fear, with assessment. Her shoulders lifted slightly, then lowered, and her hands stayed open. Her eyes scanned the hallway corners in a quick sweep, then returned to the patient's monitor like nothing had happened. Jamal saw it. Tina saw it too, from the desk, her gaze sharpening. "You okay, Maddox?" Tina asked. Claire blinked and forced a smaller breath, as if she had realized she was holding more air than she needed. "Yes." Just surprised. The lie was gentle. Tina did not call it out. She wrote a note on her clipboard anyway, not about discipline, just a reminder to watch. On the second day, Claire learned the supply room faster than people who had been there for months. She did not wander the shelves. She went straight to what she needed, hands moving with certainty that looked like memory. Jamal asked where she had learned to organize trauma supplies. "Clinic work," she said. He watched her pull exactly the right size chest tube tray for an incoming stab wound without checking the label twice. He watched her set up suction tubing without tangling it like she had done it in the dark. Jamal leaned close. "You sure you were just in a clinic?" Claire's eyes stayed on the task. "Clinics have emergencies too." That night, during a code blue on a man with sepsis, Dr. Lena Hart ran the room. Dr. Hart was in her late 30s, sharp, controlled, the kind of attending who could push a team hard without losing their trust. She called out compressions drugs, airway rhythm checks, her voice cutting through noise like a scalpel. Claire stood at the side and worked like someone who knew the choreography. She handed the laryngoscope when it was needed, not after. She adjusted the oxygen flow before the respiratory therapist said a word. She spotted the resident's trembling hand on the syringe and moved closer, not to embarrass him, but to steady the moment. "Breathe," Claire murmured, quiet enough that only he heard. "Slow. You've got it." When the patient regained a pulse, the room exhaled in a sound that was half relief and half exhaustion. Dr. Hart looked up, eyes scanning, then paused on Claire. "You're new," Dr. Hart said. "Yes," Claire answered. "You work like you are not." Claire's mouth tightened for a fraction of a second, then softened. "I learn fast." Dr. Hart held the look a beat longer, then turned back to the patient. "Chart it." ICU admit. Later, while the team cleaned up, Tina approached Claire at the sink. "You did good tonight," Tina said, scrubbing her hands. "Thank you," Claire replied, eyes on the water. Tina's voice lowered. Where did you work before the clinic? Claire's hands paused under the stream. There was a faint line around her wrist, pale like an old watch mark, but higher up there was something else, a broader tan line that did not match jewelry. Just the clinic, she said. Tina did not push. She dried her hands and walked away, but she walked away thinking. By day 3, people had decided Claire was quiet. That became the label, and labels made staff feel safe. Quiet nurse, good worker, keeps her head down, no drama. In a building where drama could cost lives, that sounded like a blessing. Claire did not sit with the group in the break room. She ate quickly and alone, a protein bar, a small container of plain rice water, never soda. Her phone stayed face down. She did not scroll. She did not laugh at the jokes about doctors. She listened, and then she returned to the floor as if breaks were simply a pause button, not a human need. Jamal tried again anyway, one late afternoon when the pace slowed, just enough to notice loneliness. "You got family out here?" he asked, leaning against the counter. Claire taped a dressing with clean, tight edges. "Not in Reno. Friends." She lifted her eyes, then looked past him to the hallway. "Not really." That answer should have sounded sad. It didn't. It sounded chosen. Jamal followed her gaze. "You always look at the exits." Claire's hand did not stop moving, but her voice shifted softer. "Habit." "From what?" Claire finished the tape and pressed it flat. "From learning that rooms change fast." That was the closest she came to letting the truth touch the air. Crescent Valley was a civilian ER with civilian rhythms. Patients arrived in wave storms of need and silence, and the staff wrote it on protocols built for predictability. Triage categories, trauma alerts, stroke codes, chest pain pathways. The system kept people alive because it was consistent, because it did not depend on heroism. Claire did not fight the system. She fit into it. She respected it. But sometimes Jamal noticed she watched it the way someone watches a fence that might not hold. On day 4, an elderly veteran came in from a nearby motel, confused, dehydrated skin, hot with fever. His hands shook when anyone tried to touch him. He barked at staff with a voice that carried old authority, and then he apologized immediately, ashamed of his own volume. Claire stepped into the room and did not try to soothe him with pity. She spoke to him like an equal. "Sir, I'm Claire. I'm going to start an IV. I'll tell you before I touch you." The man's eyes narrowed. "You military?" Claire's face stayed neutral. "I'm a nurse." The veteran's gaze dropped to her hands. They were steady. He nodded once, then turned his head, giving consent without saying it. Jamal watched from the doorway. When Claire finished and taped the IV, the veteran's shoulders loosened. His breathing slowed. "You've got away with them," Jamal said when they stepped out. Claire rinsed her hands. People want to know what's happening to them. That was true. It also did not explain why her voice had landed like something familiar. On day 5, a teenager rolled in with a gunshot wound to the thigh, bleeding controlled but heavy, the smell of iron strong enough to cut through antiseptic. The teenager's friends hovered in the hall, faces, hard eyes, furious hands twitching in pockets. Security stood close, watching for weapons. Most of the staff avoided eye contact with the group. It was safer that way. Claire did not avoid anything. She glanced once, then returned to the patient with the same calm she had shown everyone else. She explained what she was doing step by step. She did not speak faster when the teenager cursed. She did not flinch when someone in the hallway punched the wall. When the teenager finally looked at her, anger giving way to fear, Claire met his gaze. "You're going to keep your leg," she said, "but you need to hold still." The teenager swallowed. "How you know?" "Because I'm looking at you," Claire said. And somehow he held still. That night, Tina Wu found Claire at a computer station charting. The ER around them was loud, but the space between their voices was quiet. "You volunteer for overtime a lot," Tina said. Claire did not look up. "It needs to be covered." "You do not complain," Tina added. "There's nothing to complain about." Tina's eyes narrowed. People who say that usually have something else going on. Claire stopped typing. For a moment, her face looked tired, in a way that had nothing to do with work. Then the mask returned. "I like being useful." Tina studied her, then nodded slowly. "Fine. But if you ever feel like you're not okay, you say it. This job eats people alive. Claire's mouth curved into a faint smile. I'll be fine. On day 6, Dr. Hart noticed something that bothered her. A new nurse should hesitate at the edge of a trauma bay, not because of weakness, but because the mind needs time to build the map. Claire did not hesitate. She moved through it like it was a room she had been in before. After a difficult case, Dr. Hart caught Claire in the hallway. "Where did you learn trauma patterns?" Dr. Hart asked. Claire's eyes flicked not to Dr. Hart, but down the hall, then back. In school. In practice. Dr. Hart did not accept that, but she also did not accuse. She softened her tone. "I'm not trying to pry," she said. "I'm trying to understand what kind of nurse you are." Claire's jaw tightened. A good one. That was not defiance, it was self-defense. Dr. Hart nodded once. "Then we'll work well together." She turned away, but she carried the question with her. On day 7, the ER felt almost peaceful for an hour. The kind of peace that comes when a storm is gathering just out of sight. Claire worked triage for part of the shift, taking vitals, asking questions, watching faces. Her eyes lingered on hands, on posture, on the way people moved when they lied. A man with abdominal pain kept shifting in his chair, trying to look casual, while his pupils stayed too wide. Claire asked him about drugs. He denied. Claire nodded as if she believed him, then quietly notified the physician, who later found the man had swallowed packets of fentanyl. Jamal whistled when it was over. "How did you know?" Claire capped a pen. He held his breath when he answered. That answer was so simple, it sounded like luck. It wasn't. By evening, the shift rotated. The sun bled out behind the mountains, leaving the city in artificial glow. The waiting room filled with the usual mix: minor injuries, chronic pain, fatigue. Nurses moved through it all with practiced patience. Claire walked to the break room and sat alone at the far end, eating quickly, eyes down. She listened to the building. Not the talk. The building. The elevators. The doors. The distant echo of someone running down a hall. The way sound traveled differently when the air changed. Jamal stepped in and tossed a snack on the table near her. "You ever do anything fun, Maddox?" he asked. Claire chewed, swallowed. "I sleep." That got a laugh out of him. "That's a lie. Nobody sleeps in healthcare." Claire did not laugh. Her eyes lifted, and for a moment he saw something behind them, a fatigue that looked older than her resume. "I try," she said. Jamal's voice gentled. "Reno can be rough if you do not know anyone." Claire nodded once, a small motion. "I know." He almost asked. Again, almost pushed. Then stopped himself. He had seen people bolt when pressed, not because they were guilty, but because they were guarding a wound that had never been allowed to heal. A call bell chimed in the hallway. Jamal stood. Duty pulled him away. Claire finished her food, wiped her hands, and walked back out onto the floor. The ER was bright and busy, the same as always, yet her body moved differently now, like she was listening for something the rest of them could not hear. Near midnight, she stopped at the nurse's station to sign off a chart. Tina Wu was there, flipping through bed assignments. "You're off in 2 hours, Tina said. "Go home when it's time." Claire nodded, yes. Tina's eyes softened. "You're doing fine. People like you tend to think they have to earn the right to take a breath. You don't." Claire's fingers paused on the keyboard. A breath escaped her, slow and controlled. "Thank you." Tina watched her for a moment longer, then turned away as a phone rang. The night settled into routine. A drunk man arguing with a monitor cuff. A woman with a migraine begging for silence. A child with a broken arm, staring at the ceiling, trying not to cry. Claire moved through them all, competent, quiet, almost invisible. Then at 12:47 a.m., the sound hit the building like a thrown object. A hard metallic crash from the ambulance bay. Not a cart bumping a wall. Not equipment shifting. Something forceful, urgent, violent. Conversations faltered. Claire's head turned first. Her posture changed, shoulders, lowering stance, widening slightly as if her body was bracing itself before her mind could catch up. A second sound followed, deeper, heavier. Boots on tile, arriving in rhythm that did not belong to civilians. Tina looked up sharply. "What is that?" Jamal stepped toward the hallway, frowning. Claire did not move yet. She watched the entrance as if she could already see what was coming through it. and then cutting through the building's usual noise came a bark so commanding it felt like an order. The automatic doors at the end of the corridor slid apart. The automatic doors at the end of the corridor slid apart. Cold air rushed in first, carrying rain diesel and the sharp metallic scent that never belonged in a hospital. Then the sound hit. Wheels screaming over tile boots landing hard in a cadence too clean to be accidental. 3 Marines drove a gurney through the entrance like they were breaking through a perimeter. Their uniforms were dusted with grit that did not match Nevada streets. One of them had blood on his forearms smeared in a way that looked like he had already tried to wipe it off and failed. Another kept his head moving, scanning corners and doorways, with a discipline that did not soften just because the walls were white. At the side of the gurney, a corpsman ran hunched over his patient, forearms locked as he held pressure on the general's abdomen. His gloves were soaked. His voice stayed, even anyway, each word clipped and controlled. "Stay with me, sir," he said. Not pleading, not hoping, just commanding reality to hold for another minute. The patient's face was ashen under the bright lights. Lieutenant General Malcolm Rourke lay strapped to the gurney, eyes closed, lips parted as if every breath had to be negotiated. His uniform was torn at the shoulder, darkened at the chest. Pressure dressings were already in place, applied with speed and violence. Blood still found ways around them. And at the foot of the gurney stood the reason the entire emergency department stopped moving. A German shepherd, not lost, not frightened. Not the kind of dog that might wander into a lobby and wag his tail at strangers. This one moved like a weapon that had learned patience. His paws planted wide shoulders, high head-level eyes forward. A tactical vest hugged his ribs, scuffed and worn from use. A patch on the side read a single name in block letters, Gunner. The dog's growl rolled out low and steady, not loud enough to panic the waiting room, but deep enough to vibrate through the tile under everyone's feet. It did not sound like anger. It sounded like a boundary. Claire felt her throat tighten before she realized she had stopped breathing. The normal hospital noises did not stop, not completely. A monitor beeped somewhere down the hall. A phone rang twice at the nurse's station, then stopped when no one answered. A child in the waiting room began to cry, then got quiet, as if the adults had frozen him with their silence. Charge nurse Tina Wu was the first to move. She stepped out from behind the triage desk, clipboard in hand, the way she did for every trauma alert. Her face shifted as she took in the uniforms, the dog, the blood, the patient. "Trauma Bay 1, Tina said. Her voice did not rise. It cut straight through the air. "Now." Dr. Lena Hart appeared from a hallway door, pulling gloves on as she walked. Her eyes snapped to the gurney, then the dog, then back to the patient. The doctor's body did what it always did in crisis. Close distance. Take control. Touch the patient. Start the work. She stepped toward the gurney. Gunner surged forward. It happened too fast for most people to track. One moment, the dog was still the next. He was a blur of muscle and teeth, jaws snapping through empty air and stopping a breath away from Dr. Hart's wrist. He did not bite. He did not miss by accident. He stopped exactly where training ended and warning began. Dr. Hart froze with her hand half-raised, eyes wide for only a second before her discipline locked back in. The growl deepened, vibrating through the room. Everyone felt it, not just heard it. A security guard near the wall moved on instinct, fingers curling around his holstered sidearm. The leather made a small sound. One of the Marines saw it. His shoulders tightened. His hand moved not toward a weapon, but into a posture that said he could cover distance in a heartbeat. A different Marine stepped slightly forward, placing himself between the guard and the gurney, with a calm that looked like restraint, only because nobody had seen what he was restraining. "Easy," he said, eyes on the guard. "Nobody wants this to go wrong." The guard's hand stopped. Jamal Price stood near the nurse's station, with a roll of tape in his hand, forgotten. His mouth was slightly open, like his brain was trying to understand how a hospital could suddenly feel like a foreign country. Tina's gaze flicked from the dog to Dr. Hart. "Lena." Dr. Hart did not look at her. She kept her eyes on the dog, measuring breath posture distance. He's trained. Working dog, the corpsman said without looking up. His hands stayed on the general's abdomen. Pressure never wavered. He will not stand down unless he recognizes authority. Dr. Hart's voice stayed steady. Where is his handler? The Marine at the foot of the gurney answered. His handler is on the bird headed to base medical. We diverted here because he was going to die before we made it. Tina shifted her weight. We need access. Now. The corpsman's eyes flicked up for the first time. There was exhaustion there, and something sharper beneath it. His blood pressure is falling. He is bleeding internally. A monitor on the gurney showed numbers that looked unreal for a living person. The beeping was uneven. The line on the screen rose and fell like it was arguing with itself. Dr. Hart held her hands up, palms open. I'm going to help him. Gunner's eyes never left her. The growl continued steady as a motor. The Marines did not raise voices. They did not make threats. They just held space in a way that told the room they were not here to negotiate about the general's safety. Tina signaled to a nurse at the desk. Call ICU, call surgery, get blood ready. A resident stepped forward, trying to be useful, trying to find the edge of a problem he could solve. Should we muzzle the dog? The Marine nearest him turned his head slowly. His name tape read, Holt. No, Holt said. The resident swallowed. Sedation, then. We can have pharmacy. You sedate him. He stops breathing, the corpsman said. You miss your dose, and he goes down hard, and you just turned a controlled working dog into a disoriented animal in a crowded room. The resident's face flushed. We have to do something. We are doing something, Tina snapped. We are keeping everyone abaiki. Mark Vance, the security coordinator, arrived at a brisk walk, radio clipped to his shoulder, eyes sharp. He took in the dog first, then the Marines, then the gurney, then the medical staff held at a distance. What's the situation? Vance asked, voice controlled. Dr. Hart answered without looking at him, wounded general, working dog blocking access. Vance's gaze dropped to the guard's holster, then to the Marines. Hospital policy states if an animal poses immediate danger. Holt's eyes flicked to Vance. Policy does not apply here. Vance drew in a breath. It applies everywhere in this building. The dog's growl filled the space between them like a third voice. The corpsman's voice cut in rough now. He is dying. That was the simplest truth in the room. No policy could argue with it. Tina moved closer, careful hands visible stepping into the line of fire between authority and instinct. She spoke to the Marines the way she spoke to families during codes. Calm, firm, honest. We have a trauma bay ready. We have blood. We have a surgeon on the way. But my doctor cannot touch your patient. Holt's jaw worked once. You touch him without the dog's consent, and we have a different kind of emergency. Dr. Hart's eyes narrowed. Are you threatening my staff? Holt did not blink. I'm describing what happens when you cross that dog. A second doctor, older, stepped in from the hallway, drawn by the commotion. He took one look at the dog's posture and stopped short. This is insane, he muttered. Jamal felt his own pulse in his ears. He wanted to say something to fix the moment with words, but his brain kept circling the same fact. The general's heart did not care about their standoff. The general's heart would stop anyway. Claire stood a few steps behind Tina. She was not close enough to be in danger, but close enough to see details nobody else seemed to be seeing. Gunner's body was tense, but not chaotic. His head was angled toward the general, not toward the crowd. His ears tracked movement, but his feet did not shift unless someone closed distance. His eyes were not wild. They were focused. This was not panic. This was mission. Claire's mind sorted the room the way it always did when the air changed. Marines protecting a perimeter, a corpsman maintaining pressure, a doctor trying to assert care through proximity. Security reading threat through policy. Staff freezing because they were not trained for the shape of this. She heard Tina's earlier warning in her head, stay back. You're too new, and felt the familiar pressure behind her ribs, the instinct to disappear. Then she saw the monitor. The numbers slid again, indifferent, patientless, cruel. The corpsman's voice turned even tighter. Systolic 68. Dr. Hart's mouth tightened. We can't wait. Someone whispered, animal control. Someone else whispered tranquilizer. Holt's response was quiet and immediate. Vance shifted his stance. You do not have the authority to override hospital security. The Marine beside Holt Ramirez let out a slow breath through his nose the way people do when they are choosing restraint. You don't understand who he is, Ramirez said, nodding toward the gurney. Vance lifted his chin. He's a patient. Ramirez's eyes hardened. He's not just a patient. The general's chest rose again, shallow. The rise looked smaller than the last. Dr. Hart took a slow step, testing the boundary without committing to it. Gunner's head snapped toward her. The growl sharpened. Dr. Hart stopped. She did not retreat, but she did not advance. Okay, she said quietly, as if speaking to the dog might change physics. Okay. The corpsman did not look up. He knows one voice. He knows one set of commands. Without that, he holds. Tina glanced at Claire. She saw Claire watching the dog instead of the people. She saw Claire's stillness, the way her shoulders were lowered, not in fear, but in intent. Tina stepped closer to Claire and lowered her voice. Maddox, do not. Claire did not answer. Tina's eyes sharpened. Claire. Jamal shifted, turning to look at Claire. Something in her posture made his stomach drop. He had seen that posture on veterans in the waiting room sometimes, the way they looked when they heard a sound that pulled them somewhere else. Claire took one step forward. It was a small movement, soft shoe against tile, yet it cut through the room like a signal. Heads turned. Even the Marines noticed their attention flicking toward her with brief confusion. Tina reached out a hand, then stopped herself. Touching Claire right now felt like it might be the wrong kind of contact. Claire walked past the nurse's station, past the edge of the crowd, and stopped several feet away from Gunner. She did not cross the line. She respected it. Her hands stayed visible at her sides. Her breathing stayed slow. Gunner's ears twitched. His eyes slid to her. The growl continued, but it did not rise. Claire lowered herself to one knee with a smoothness that did not look rehearsed so much as lived. Her movements were economical, controlled. She did not stare at the dog's eyes like a challenge. She let her gaze rest on his chest, his shoulders, the angle of his head. The Marines stiffened. Ramirez started forward. Ma'am, Ramirez said, voice tight. Step back. Claire did not look at him. Her attention stayed on Gunner. She spoke softly, not in a soothing baby voice, not in the bright tone people used when they were afraid of dogs and tried to hide it. Her voice carried a flat authority like a door closing. Gunner's growl faltered for half a second, then resumed. Claire's eyes flicked once to the general, then back to the dog. The corpsman looked up startled. Who is she? He asked. Not accusing, just shocked. Tina's hands curled into fists at her sides. She could feel her own career flashing through her mind, policies and incident reports, and the way hospitals punished people for stepping out of line. She also saw the monitor. She also saw the general slipping away. Claire leaned forward just a fraction, stopping at a precise distance that kept her outside the dog's perimeter while still close enough to be heard. Then she spoke 3 words. 77. Actual. Down. The words were not loud. The cadence did the work. Sharp. Clipped. Certain. The effect was immediate. Gunner's growl stopped mid-vibration like someone had flipped a switch. His ears came forward. His body did not relax fully, but the coil in his shoulders loosened. He blinked once, then again, eyes moving over Claire's face, as if searching for a match he had been trained to confirm. For a moment, the dog looked almost human in the way he processed it. Then he sat. Not slowly, not reluctantly. He sat with the controlled obedience of a soldier receiving an order from someone he recognized. His head lowered toward the general, resting lightly against the gurney, guarding without blocking. The room did not move for 3 seconds. It was too stunned. Dr. Hart's voice came out rough. How did you... She stopped because the only answer that made sense was the one nobody wanted to say out loud. Holt stared at Claire. His expression had shifted from suspicion to something more complicated, like recognition fighting disbelief. Ramirez's mouth tightened. He leaned close to Holt and said something too quiet for the staff to hear. The corpsman's eyes widened, then narrowed. He looked at Claire like she was a puzzle that had just solved itself. Tina turned toward Claire, and the words she wanted to say tangled in her throat. Are you insane? Who are you? How did you do that? All of it collided with the fact that the dog had sat and the general was still alive. Dr. Hart snapped back into motion. She stepped in quickly gloved hands, reaching the gurney with the urgency she had been forced to hold back. Move him, she said. Trauma Bay 1, now. The gurney rolled forward. Nurses moved alongside, grabbing IV poles, clearing a path, calling out for blood. The resident sprinted ahead to open doors. The security guard backed away, hand nowhere near his weapon now. Claire rose from her knee and walked with the gurney. Gunnar stood and followed without hesitation. Claire placed one hand lightly on his collar, not gripping, not pulling. Just present. A point of connection that told the dog the perimeter could move and still be safe. Holt fell into step beside the gurney, the eyes scanning the corridor. Ramirez took the other side. The corpsman stayed at the general's abdomen pressure, unbroken jaw clenched. They moved through the emergency department like a convoy, and the building changed around them. People pressed against walls. A family in the waiting room fell silent as the gurney passed, catching the smell of blood and the sight of the dog's vest and the Marines' faces. Dr. Hart walked at the head, calling orders over her shoulder. Get me 2 units O negative. Call surgery again. Notify ICU, we may need a bed in minutes. Tina matched her stride voice steady. Blood bank is on the way. Ultrasound is ready. Respiratory is standing by. Jamal jogged alongside, grabbing supplies from carts as they moved. His mind was still stuck on the moment the dog sat. He kept looking at Claire, trying to see the person he thought he knew inside the nurse he had worked beside for 7 days. Claire did not look back. Her eyes stayed forward, locked on the general's face, and the monitor display bouncing with every jolt of the gurney. She watched the numbers the way some people watched a cliff edge. The general's eyelids fluttered once, as if he was trying to surface. His lips moved without sound. The corpsman leaned close. Sir, stay with us. The general's hand twitched, then fell still again. Gunnar kept pace, silent now. His eyes moved constantly, tracking hands, doors, corners. Yet every few seconds, his gaze flicked to Claire's hand on his collar, confirming the connection. They reached Trauma Bay 1. The doors were already open, the room bright and stripped equipment staged like weapons on a clean table. A respiratory therapist stood ready with oxygen. A tech waited with a portable monitor. A surgical tray sat under a sterile drape. Dr. Hart stepped inside first, turning as the gurney crossed the threshold. For the first time since the Marines had burst into the hospital, Crescent Valley Medical Center moved like it knew what it was doing again. But the air in the trauma bay felt different than it had an hour ago. Not because of the blood, not because of the general's rank, because someone new had entered the equation and nobody knew where she fit. Tina glanced at Claire as the team positioned the gurney beside the bed. Claire, Tina said quietly, voice tight, "Stay where I can see you." Claire met her gaze for a fraction of a second. Her eyes were calm. Not blank, not cold, just controlled. "I will," Claire said. Dr. Hart snapped her gloves tighter. "All right," she said, voice steady, commanding the room. "Let's work." "All right," Dr. Hart said, voice steady. "Let's work." The trauma base snapped into motion like a machine that had been waiting for a missing gear. Gloves pulled tight. A monitor cart rolled in and locked. Someone tore open a package of gauze with their teeth because their hands were already busy. The air filled with the wet metallic smell of blood, warmed by a human body and broken open by force. "Transfer on 3, Tina Wu called, taking position at the side rail. 1, 2, 3. They slid General Rourke from the gurney to the trauma bed. His body felt wrong in the way bodies do when the inside is failing. Heavy and light at the same time. His skin was cool, damp with sweat. His lips had gone pale, the color draining away as if the rest of him was trying to follow. The corpsman, Derek Shaw, did not let go until the last second. He kept pressure on the abdominal dressing forearms, locked, eyes fixed on the wound, as if looking away would invite it to bleed faster. "Report," Dr. Hart said. Shaw's voice did not wobble. It was steady in the way of people who have practiced fear until it becomes useful. "Male, late 50s. Blast injury. Visible shrapnel to right shoulder and right abdomen. Hypotensive on arrival. Systolic 70 on the bird, now 65. 2 liters crystalloid en route. 1 unit whole blood started, but we ran out. He had a brief drop in consciousness. Pupils equal. No obvious head trauma. Pain response diminished. Dr. Hart's eyes flicked over the general's body like a scan line. Airway. Respiratory therapist Mateo Collins stepped in at the head. He's protecting it. Shallow. Fast. Dr. Hart looked at the monitor as it attached. Heart rate 140. Oxygen saturation 91, then 89. The number wavered like a candle in wind. 2 large-bore IVs now. Tina said, already stripping tape and setting up lines. Type and cross. Get blood in the room. A nurse sprinted out, calling to the blood bank over her shoulder. A resident tried to place an IV and missed once, then again. Tina's hand shot in, not unkind, not patient, just efficient. Switch, she said, taking the catheter and sliding it in on the next attempt. Blood flashed. Tape snapped. Dr. Hart pressed gloved fingers into the general's sternum. Sir, General Rourke, can you hear me? No response. Only that shallow rise and fall, as if the lungs were arguing with the chest wall about whether they still wanted the job. Shaw stayed close hands still on the abdominal dressing. His eyes tracked every movement around the bed, every person who leaned in. He looked like he was holding back a second emergency with the force of his will. In the corner, Gunnar stood at the threshold. He had followed Claire into the trauma bay and stopped there planted watching. His body was no longer coiled to strike, but he was not relaxed either. His head pivoted with every person who entered the room. His eyes were sharp, unblinking, and every few seconds they flicked to the general's face, as if checking whether the mission had changed. Claire stayed near him close enough that her presence mattered far enough that she was not in anyone's way. Her hand rested lightly on his collar. The touch was not a grip. It was a signal. She kept her breathing slow, shoulders lowered, giving the dog a steady point to anchor to in a room built from alarms. Dr. Hart noticed the dog only long enough to confirm he was not going to lunge. Then her focus narrowed back to the patient. Fast exam, she said. Now. A tech rolled the portable ultrasound closer. Gel was spread across the general's abdomen. The probe pressed in. The screen filled with grainy shades of gray that meant nothing to most people, and everything to the ones trained to read them. A resident called out landmarks. Right upper quadrant. Morrison's pouch. Free fluid. Dr. Hart leaned in, eyes tight. How much? Looks like a lot, the resident said, and his voice lifted at the end as if asking permission to be afraid. Dr. Hart did not give him permission. Mark it. Move. The probe shifted to the left upper quadrant, then the pelvis. More fluid. The general's blood pressure dipped again. The monitor beeped like a warning that was running out of patience. Massive transfusion protocol, Dr. Hart said. Tina's voice carried out the orders. MTP, activate. Now. Someone repeated it into a phone. Someone else sprinted. The room filled with movement that was practiced enough to look calm. Underneath, the calm time was peeling away. Dr. Hart pressed fingers into the shoulder dressing. Shrapnel had torn the muscle. The wound was ugly, irregular, and still oozing. She moved to the abdominal dressing. Blood pulsed faintly under the gauze, a pressure trying to escape. Dr. Hart said, "We're not fixing this here. Surgery needs to open him." "Surgeon is 5 minutes out," Tina answered. "Then we hold him for 5 minutes," Dr. Hart said. She looked up at Shaw. "Any tourniquets? Any hemostatics?" Shaw shook his head once. "We packed and held pressure. That's all we had time for." Dr. Hart nodded. She did not blame him. She just took the reality and moved. Mateo, at the head of the bed, lifted a bag valve mask. "Sats are dropping. I can assist ventilation." Dr. Hart watched the general's chest. The rise was small. The breaths were fast, shallow, like a person trying to sip air through a straw. "Do it," she said. Mateo sealed the mask and began to squeeze. The general's chest rose higher under forced air. The saturation climbed to 92, then dipped again as soon as Mateo paused to let him exhale. "Keep going," Dr. Hart said. Slow, controlled. A nurse hung the first unit of blood. The dark bag swung slightly as the line connected. The drip chamber filled and cleared. Blood entered the general's body like a promise that was late. Claire watched the monitor without moving. She kept her eyes on the oxygen saturation and the respiratory rate. The saturation number wavered in a pattern that felt familiar to her in a way she did not want to name. It climbed under ventilation, then slid again in slow steps, indifferent to effort. She looked at the general's chest. The rise under the bag valve mask looked uneven, as if one side resisted more than the other. Subtle, easy to dismiss in the noise of a trauma bay. But once you saw it, it was hard to unsee. She shifted her gaze to the general's neck. No obvious swelling, no tracheal deviation she could see from this angle. Still, the saturation kept dipping back down. Mateo called out breath sounds, right side louder. Could be pain, a resident said. Shrapnel on the right. Dr. Hart did not answer him. She stayed on the abdomen, on the blood, on the fluid in the fast exam. That was the obvious threat. That was the fire in front of them. Claire's eyes slid back to the right side wounds. They were loud injuries. They demanded attention. They were honest in their violence. The general's body, however, was doing something quiet. Tina pressed along the abdomen to check rigidity. The general did not react. His face stayed slack. Pain response was muted, but that could be shock medication, exhaustion, or all three. A resident checked the right side again. Tenderness, here. Then a hand brushed lower on the left ribs while repositioning the patient. The general's muscles tightened in a quick, involuntary guarding a half-second flinch that did not make a sound. Claire's eyes narrowed. Right side wounds, left side guarding. She watched Mateo squeeze the bag again. The right side rose more. The left lagged. Could be splinting, someone said. Claire did not speak yet. She forced herself to scan the room as if she were a civilian nurse who only knew the patterns from textbooks. Abdominal bleeding, hypotension. Fast, positive. Go to surgery. That was correct. That would save him if nothing else was hiding. But the oxygen saturation was not behaving like it should if the only problem was blood loss. Blood loss dropped oxygen delivery, yes. But ventilation under a bag valve mask should have shown a cleaner response than this. It climbed and slipped like air was entering, but not staying where it belonged. Claire felt a pressure behind her ribs, the same pressure she used to feel when a medic called out a number that did not match the story of the injuries. The moment when you knew you were being lied to, not by a person, but by the chaos of trauma itself. Dr. Hart called out for a chest X-ray. A tech positioned the plate under the general. The machine rolled in and clicked. A quick exposure. The image appeared on the screen. It was not perfect. The general was supine, rotated slightly. The room was too crowded. Still, the lungs were visible enough to make decisions if you knew what to look for. The resident squinted. Looks okay. Mateo frowned, maybe some haziness. Dr. Hart glanced. She was already moving back toward the abdomen. We're not waiting. We're going. Shaw's eyes flashed. He's not going to survive transport if the pressure keeps dropping. Then we push blood and press, Dr. Hart said. We do not have a choice. Claire's hand on Gunner's collar tightened slightly, then relaxed. The dog stayed still, watching her more than anyone else now. He sensed her shift, even if he did not know the reason. Claire stepped closer to the bed, not into the team's space, just close enough to see the X-ray again. The left lung field looked slightly darker, slightly more empty than it should. The mediastinum was not obviously shifted, but in a supine film that could be subtle. The haziness could be artifact. It could also be the beginning of collapse. She looked at the saturation number. 88, 87. Mateo squeezed again, trying to keep it up. Dr. Hart's voice cut through. Surgery, where are you? Tina answered. 2 minutes. Dr. Hart turned back to the abdomen. Prep for OR. We're opening the belly. The words hit Claire like a cold splash. If the left lung was collapsing under increasing pressure, intubation, and positive pressure ventilation on the way to the OR could turn a quiet problem into a lethal one in seconds. Attention pneumothorax did not always announce itself with dramatic deviation and distended neck veins. Sometimes it crept in built pressure with each assisted breath, and then suddenly the heart could not fill. Claire's mouth went dry. She heard Tina's earlier warning in her head again. Stay where I can see you. She felt the weight of being new, of having a badge that had been issued 7 days ago, of being one signature away from disappearing from this hospital. She also saw the monitor. Dr. Hart looked up. Anyone seeing anything else? The question was meant for the room, for the team, for the collective brain of trauma. Residents glanced at each other. A nurse shook her head. Mateo hesitated, then started to speak, then stopped. Claire heard herself inhale. Doctor, she said. Her voice was quiet, not timid, just controlled. The room did not stop, but Dr. Hart's head turned slightly, eyes flicking toward her. Yes, Dr. Hart said tight. Check his left chest, Claire said. A pause hit the air, brief but heavy. Dr. Hart's eyebrows drew together. His visible injuries are on the right. I know, Claire said. The resident who had earlier asked about muzzling the dog looked at Claire as if she had stepped onto a stage without permission. Who is this nurse? He muttered. Not low enough. Tina's eyes narrowed sharply at him. Claire kept her gaze on Dr. Hart. His oxygen saturation is dropping in a pattern that does not match just blood loss. Breath sounds are asymmetric. He guarded on the left lower ribs. Mateo looked up surprised. I did say right side louder. Dr. Hart's jaw tightened. Are you suggesting pneumothorax? Tension pneumothorax developing, Claire said. She did not raise her voice. She did not soften the words. She spoke them the way you speak when the clock is not interested in politeness. Left side, likely from blast concussion. No entry wound. It can hide. Shaw's head snapped up. For the first time since he entered the hospital, his composure cracked. Not fear recognition. He stopped himself. Dr. Hart stared at Claire a full second. Now, the kind of stare that measures whether a person is reckless or certain. The difference between the two could kill someone. How do you know? Dr. Hart asked. Claire swallowed once. Because I've seen it. Because the pattern fits. Dr. Hart looked back at the monitor. 86. She made a decision. Ultrasound on the left chest, Dr. Hart said. The tech moved the probe upward. Gel smeared along the left chest wall. The screen shifted to a view that was harder for most eyes to interpret quickly. Dr. Hart leaned in. Mateo leaned in. Tina leaned in. Even the resident leaned in, trying to make sense of gray noise. Dr. Hart watched for lung sliding. She watched for the absence of it. Her face changed, not dramatically. Just a tightening around the eyes that meant she had found something she did not like. No slide, she said. Mateo's voice went low. That's pneumothorax. Claire held still, as if moving would break the thin line of focus, holding the room together. Dr. Hart did not waste time. Needle decompression, she said. Now. A nurse snapped open a kit. The sound of plastic tearing was sharp. A large bore needle appeared in Dr. Hart's gloved hand. Tina moved to the general's left side, clearing space. Mark. Mid-clavicular line, second intercostal. Dr. Hart shook her head. Fifth intercostal anterior axillary. Quicker here with armor patterns and body habitus. She palpated quickly, fingers pressing between ribs, finding landmarks through skin that was slick with sweat. The general's eyes fluttered faintly. His mouth opened as if trying to speak, but nothing came out. Mateo kept ventilating slow and controlled, careful not to force too much, too fast. Dr. Hart positioned the needle. The room held its breath without realizing. She pushed. Resistance, then a sudden give. A sharp hiss erupted, air escaping under pressure, like a tire punctured loud enough to silence even the monitor beeps in everyone's perception. It was the sound of trapped air finally allowed to leave. The oxygen saturation climbed almost immediately. 87, 89, 91. The heart rate eased down a fraction. 138, 135. The general's chest rose more evenly under the bag valve mask. The left side moved like it was willing again. Tina exhaled through her nose, a short breath that sounded like anger turned into relief. Chest tube, Dr. Hart said. We're not done. A tray was opened. Instruments gleamed under the lights. The smell of antiseptic intensified as skin was prepped and draped. Shaw watched, hands still at the abdomen, but his eyes now fixed on Dr. Hart's work. He looked like a man who had been holding two disasters at once, and finally saw one of them begin to obey. Dr. Hart infiltrated local anesthetic out of habit, even though the general was barely responsive. Then she made the incision a small cut in the left chest wall. Blood did not pour just a thin line, because this was not a vessel. This was access. She used blunt dissection fingers and clamp-spreading tissue with practiced precision. Mateo paused ventilation at Dr. Hart's signal. The room moved in tight coordination, small nods, glances, words reduced to the minimum required. Dr. Hart guided the chest tube in firm pressure, then a smooth advance. When it seated, the suction canister bubbled and pulled, drawing air and fluid from the pleural space. The sound was soft, but to anyone who understood it, it was the sound of a life returning to a safer path. The oxygen saturation stabilized at 94, then 95. The blood pressure crept upward, systolic 70, then 78. The general's skin, still pale, gained the slightest hint of color. Mateo adjusted his grip on the bag. Breathing looks better. Dr. Hart nodded once without looking up, securing the tube. Good. Keep him stable. Tina called out time of chest tube placement, and someone answered, writing it down. For a moment, the trauma bay felt like it had regained gravity. The chaos was still there, but it was controlled chaos, now directed toward a purpose that had traction. Gunner at the doorway lifted his head higher, his ears angled forward. He did not understand oxygen saturation or pleural space, but he understood the shift. He understood when the room stopped smelling like panic. His eyes flicked to the monitor, then to the general's face, then to Claire's hand on his collar. He settled, still guarding, but no longer ready to explode. Dr. Hart stepped back from the chest tube and looked at the general again. She pressed a hand to his sternum, assessing movement rhythm response. Okay, she said quietly, more to herself than the room. Okay. Shaw's shoulders dropped a fraction, the first sign that he was not made entirely of tension. Abdomen still a problem, Dr. Hart said, snapping back. We're still going to the OR, but now he'll survive the trip. The resident swallowed hard, face flushed. He avoided looking at Claire. Tina, however, did look at her. It was not anger. It was the wary look of someone who has just watched a new variable alter the outcome of a life, and now has to figure out what to do with that variable. Dr. Hart turned toward Claire fully for the first time. The room did not stop moving, but the attention shifted anyway. People could multitask. They could tape lines, hang blood adjust, drips, and still listen. Dr. Hart's voice was quiet. How did you catch that? Claire's mouth opened, then closed. The simplest answer was the truth. The truth was too large for this room. I watched the pattern, Claire said. It didn't fit. Dr. Hart's eyes narrowed slightly. That's not a textbook answer. Claire held her gaze. Textbooks are not here. Tina's lips pressed into a line. Jamal stood at the foot of the bed, holding a package of gauze he had forgotten to open, staring at Claire as if she had just spoken in a voice he had never heard from her. Mateo looked between Dr. Hart and Claire. She was right, he said, not to defend, just to anchor reality. It was hiding. Dr. Hart nodded once. Her attention returned to the general. Good catch. Now stay out of the way unless you see something else. Claire nodded, accepting the boundary. She did not need permission to see. She only needed permission to speak, and she had just spent it carefully. Blood continued to flow into the general. The pressure climbed to 86 systolic, still fragile, but improved. The heart rate stayed high, but not as frantic. A surgeon arrived, Dr. Nina Caldwell, hair tucked under a cap, eyes sharp. She took in the scene in a second, then asked for the short version. Dr. Hart gave it. Blast injury. Positive fast. Chest tube placed for left tension pneumothorax. Stabilizing with blood. Or now. Caldwell's eyes flicked to the chest tube, then to the general. Good. Move. They prepared for transport. The bed released from its locks. Lines were secured. The chest tube was checked. The suction canister was strapped to the side. The ventilations were transitioned, careful and controlled. Tina moved to the head of the bed beside Mateo. On my count. We're moving. Dr. Hart glanced toward the doorway. Gunnar remained there still as a statue, blocking no one but controlling the psychological space of the room. Marines Holt and Ramirez stood outside the bay, their silhouettes visible through the glass. They had stayed back, allowing medical staff to work, but their attention never left the general, the dog, or Claire. Shaw stepped aside as the bed began to roll, then fell back into position at the side, hands ready to reapply pressure if the dressing slipped. "Clear," Tina called. The bed rolled out of Trauma Bay 1 and into the corridor that led toward the elevators and the operating rooms. The hallway lights reflected off the bed rails. The wheels hummed. The hospital's normal sounds returned around them in fragments, an overhead announcement, a distant phone, a child's cough. But the corridor itself tightened as if everyone sensed a procession and did not want to interfere. Dr. Hart walked at the front with Caldwell. Tina and Mateo managed the airway. Jamal stayed at the side carrying supplies like an offering. Shaw hovered near the abdomen. Marines Holt and Ramirez flanked the group without being asked, scanning ahead. And Gunnar moved with them. He paced beside the bed close enough to watch the general's face, but never crossing into the staff's work. He moved like a disciplined guard, ears, tracking eyes, shifting body controlled. Every few steps, his gaze flicked to Claire. Claire walked beside him. Her hand remained on his collar. Her posture was calm, her breathing steady, as if she had placed herself into a rhythm that the dog could match. The elevator doors opened. The group rolled in. The space was tight. The air smelled like cleaning solution and old metal. Holt glanced at Claire, and for a moment, his mask slipped. He did not look angry. He looked focused, as if he had just seen a detail that demanded immediate categorization. The elevator doors closed. For the first time since the Marines had entered the ER, there was a pocket of quiet that belonged only to them. A hum from the elevator motor, the faint beep of the portable monitor, the soft click of Gunnar's nails on the floor. Shaw's eyes flicked to Claire's face. He looked like he wanted to speak and did not know which language to use. Dr. Hart kept her eyes forward, but her mind was working. You could see it in the set of her jaw, the way she breathed through her nose. She did not like surprises. She liked competence. She liked certainty. Claire had provided both and had done it with a precision that did not fit a civilian resume. The elevator opened onto the operating floor. They moved fast. A nurse in surgical scrubs met them and directed them toward a bay outside the OR. "We're ready." Dr. Caldwell took over coordination with surgical staff. Dr. Hart gave a final set of instructions and then stepped back, watching as anesthesia prepared medications. Mateo positioned oxygen. Tina checked lines. Shaw kept his hands close to the abdomen, ready. Gunnar stopped at the threshold again, as if doors were a language he understood. He did not try to enter. He stayed where he could still see the general. He watched the surgical staff with the same controlled suspicion he had given the ER. Claire stayed beside him. An anesthesiologist stepped forward and glanced at the dog. "We can't have him in the OR." Holt's head turned slightly. "He's staying with the patient." The anesthesiologist's eyebrows lifted. "Not in the room." Holt's voice was calm. "Then we're right here." Dr. Caldwell did not argue. She had a patient to open and time to lose. "Fine. Keep him out of the sterile field. But he cannot interfere." "He won't," Claire said quiet. The anesthesiologist glanced at her, surprised that the new nurse's voice carried in this space too. The general's eyes fluttered again. His gaze did not focus. He was slipping toward anesthesia, drifting into a darkness that was not death, but still demanded trust. Dr. Hart leaned close. "General, we're taking you to surgery. You're in the hospital. You're not alone." The general's lips moved. Claire leaned closer without thinking. Not into the sterile space, just close enough to hear. A rasp of sound almost lost. "Gunnar," the general breathed. The dog's ears came forward. He made a low sound in his throat, not a growl, not a bark, something softer, a communication meant for one person. Claire's hand tightened gently on his collar. "Stay," she murmured, and the dog stayed. The surgical doors opened. The bed rolled through. The doors closed. The hallway swallowed the sound of the team as they moved inside. For a moment, the corridor felt too empty, like the building had exhaled and did not know what to do with the air. Claire stood with Gunnar outside the OR doors. Holt and Ramirez stayed nearby, formal, now less like escorts and more like sentries. Shaw remained for another minute watching the doors, as if his hands still held pressure through them. Tina and Jamal lingered at the edge, catching their breath. Tina's eyes were hard, but not with anger, with calculation. Dr. Hart stepped out briefly, pulling her gloves off. Her hands were steady, but her face had a faint sheen of sweat. She looked at Claire. "I want you back in the ER," Dr. Hart said. Claire nodded, yes. Dr. Hart held her gaze. "You did not guess." It was not a question. Claire did not answer right away. She chose her words the way people choose steps on unstable ground. "No." Dr. Hart looked at Gunnar, then back to Claire. "You gave him a command he recognized." Claire's throat moved. He needed clarity. Dr. Hart's eyes narrowed slightly. "Where did you learn to give that kind of clarity?" Claire's face remained neutral, but her fingers on Gunnar's collar flexed once. "I've been around working dogs," Claire said. Dr. Hart did not accept it, but she also did not push here, not outside an operating room, not with a general on the table. She nodded once and turned toward Tina. "Keep her on shift," Dr. Hart said. "I want her close." Tina's eyes flicked to Claire, then away. "She's new." Dr. Hart's voice stayed flat. "She's useful." Jamal let out a breath he had been holding. The word useful sounded like praise in this place, and it sounded like danger too. They waited. Minutes stretched. A nurse walked by with a clipboard and slowed when she saw the dog, then kept going without asking. A doctor passed and stared for a second too long. The hospital did not know what to do with Marines and a canine outside an OR. It felt like the building had been forced to share space with another world. Gunnar stayed calm. He watched every person who walked past, but he did not move unless Claire shifted. He seemed to read her tension the way he read the hallway. Claire kept her breathing slow. She stared at the closed OR doors, eyes fixed, and in the stillness, the memories pressed closer, not as images, but as sensations. The smell of burned dust, the sound of a rotor, the way radios crackled when someone needed help and did not have time to sound polite about it. Her jaw tightened. She forced herself to focus on the present. Reno. Hospital. Fluorescent lights. Clean floors. A general in surgery, not a tent, not a field station. The OR doors finally opened again. Dr. Caldwell stepped out, cap still on mask, pulled down around her neck. There was blood on her gown. Not splatter. Smears, the kind of marks that meant hands had worked fast and deep. Holt straightened slightly. Ramirez's attention sharpened. Shaw stepped closer, hope and fear colliding in his eyes. Dr. Caldwell's voice was professional, controlled. "He's alive. We controlled the abdominal bleeding. He's unstable, but improved. We're moving him to ICU." A sound left Shaw that might have been a laugh if it had not been so ragged. He nodded once, swallowing hard. Holt exhaled slowly. His eyes closed for a fraction of a second, then opened again, scanning like a man who could not afford to stop scanning even when relief arrived. Gunnar lifted his head. His ears came forward. He made that low sound again, and Claire felt it in her palm through the collar. The ICU transport team rolled the bed out. The general was pale, intubated now, machines breathing for him. Lines and tubes trailed like lifelines. The chest tube canister hung at the side, bubbling softly, doing its quiet work. Gunnar stepped forward, then stopped until Claire moved. "Easy," Claire whispered, and the dog matched her pace. The Marines flanked the bed. Shaw walked with his hands ready, eyes locked on the general's chest, rise and fall. The ICU nurse at the head called out vitals, reading numbers like they were prayers that needed to be spoken aloud to stay true. They rode the elevator up. The ICU doors opened. The smell changed, less blood, more antiseptic, a colder kind of clean. They reached the room. The ICU team took over, connecting monitors, adjusting drips, checking pupils, confirming tube placement, documenting times and doses. The general disappeared behind a curtain of expertise. Gunnar stood at the foot of the bed, calm but alert. His gaze never left the general's face. Claire stayed close enough that the dog did not challenge anyone. She kept her hand on his collar until the ICU nurse, a woman with tired eyes and a gentle voice, stepped in. "Is he going to stay?" the nurse asked, looking at the dog. Holt answered before anyone else, yes. The nurse looked at the general, then at the Marines, then at Claire. She made a decision that was more human than policy. Then he stays at the foot. No one trips on him. Gunnar lay down, obedient, chin on paws, eyes open. For a moment, the room settled. Machines beeped. The ventilator hissed softly. The general's blood pressure held. Dr. Hart stood near the doorway, watching the team work. The adrenaline had drained enough to leave behind the questions that did not have oxygen in the trauma bay. She looked at Claire again. "You saved him twice," Dr. Hart said quietly. Claire did not react as if she wanted praise. Praise felt like attention. Attention felt like threat. "I did my job," she said. Dr. Hart's expression did not soften. It sharpened. "Your job title does not explain what you did." Claire held her face steady. "Then maybe your job title doesn't explain what you do either." Dr. Hart stared for a second, then something like respect flickered across her eyes. In the hallway outside the ICU room, Tina Wu touched Claire's arm lightly just once, testing whether Claire would flinch. She did not. "You okay?" Tina asked. Claire looked past her to the ICU doors. "He's okay." "That's not what I asked," Tina said. Claire's voice stayed even. "I'm fine." Jamal stood nearby, hands in his pockets, trying to decide whether to speak. He looked like he had discovered that the person he thought he knew was only one layer of a much thicker story. "Claire," he said finally, soft. She turned her head. Jamal swallowed. "That code. The way the Marines looked at you. You weren't just guessing." Claire's eyes did not blink. "No." Jamal's voice lowered. "Then who are you?" Claire held his gaze for a moment, and in that moment, Jamal saw the edges of something heavy in her expression. Not drama, not mystery for its own sake, just the quiet weight of a life that did not fit into a hospital badge. Before she could answer, a shadow fell across the hallway. Holt had stepped out of the ICU room. Ramirez followed. Their posture had changed. Still controlled, still calm, but formal now, like a decision had been made and they were carrying it out. Holt looked directly at Claire. "Nurse Maddox," he said. His voice was respectful, and it was not optional. "We need to speak with you." Holt did not raise his voice. He did not need to. The hallway outside ICU room 7 had its own gravity now, and everyone in it felt the shift. Claire looked past him through the glass panel at General Rourke's bed. The ventilator rose and fell with a steady hiss. The monitors blinked green and yellow in a rhythm that felt almost peaceful compared to the trauma bay. Gunnar lay at the foot of the bed, chin on his paws, eyes open, watching the general's face like a guard who refused to blink first. "Not here," Claire said quietly. Holt nodded once. "Not here." Ramirez stepped to the side, creating a corridor with his body that was polite and unmistakable. It was the same posture Claire had seen at the hospital entrance, the posture that turned a civilian space into a controlled lane. Tina Wu's hand lifted as if she might stop them, then fell. Her mouth tightened. "Evan," she said, and the way she said his first name carried a warning. Holt glanced at her. "He's alive." "That's because she did what she did." Tina's eyes narrowed. "Then why are you walking her away like she's a problem?" Holt's voice stayed even. "Because what she did matters to people who will ask questions. We are asking them first." Claire stepped forward before Tina could say more. She kept her shoulders low, her hands visible, her face calm. In the hospital, in the war, in any place where authority hovered nearby, calm was armor, Claire said. Tina's jaw worked. Claire held her gaze for 1 second. A silent request. "Let me handle it." Tina exhaled sharply through her nose and stepped back. Jamal Price shifted closer eyes, searching Claire's face. He looked like someone trying to memorize a person before she vanished. "You don't have to go with them alone," he said. Claire's voice softened just enough to be human. "I'm not alone." She glanced once at Gunnar inside the room. The dog did not move, but his ears angled toward her as if he had heard the look. Holt turned and began walking. Claire followed. Ramirez walked behind and slightly to the left, a shape that prevented interruptions without needing to confront anyone. They moved down a corridor that grew quieter with each step. The ICU noise faded. The hospital's usual hum returned in layers, but it felt far away, like the building was holding its breath in certain pockets. Mark Vance appeared at the corner, the security coordinator's radio still clipped to his shoulder. His expression was tight, and his eyes did not soften when they landed on Claire. "This way," Vance said. They entered a small administrative room at the end of the hall. No windows, a table, 4 chairs, a thin folder already sitting in the center, like an accusation that pretended to be paperwork. The door clicked shut behind them. Vance took the seat nearest the folder. He did not invite anyone else to sit. Holt remained standing. Ramirez stayed near the door. Claire sat anyway, smooth, controlled back straight, hands folded in her lap. A moment passed where no one spoke. In that moment, Claire listened to the building. She could hear a distant cart rolling. A muffled overhead announcement. Someone laughing at the far end of a hallway. Life continuing like this room did not exist. Holt finally spoke. "My name is Staff Sergeant Evan Holt. This is Corporal Ramirez." Claire nodded once. "Claire Maddox." Vance's mouth tightened. "We already know your name." Holt's gaze stayed on Claire. "The dog." Claire did not blink. "Gunner." Holt nodded slightly. "You gave him a command." Claire waited. Vance leaned forward, fingers touching the folder. "That command you used is not something you pick up at a civilian hospital. It is not even something most military personnel would recognize." Claire's eyes lowered to the folder, then back to Holt. "You brought a working dog into an emergency room. I gave him clarity. That saved your patient." Holt's expression did not change. "We agree it saved him. Then why am I here?" Claire asked. Holt's eyes sharpened. "Because he stood down for you." Claire stayed still. "He stood down because I spoke correctly." Ramirez's voice cut in quieter, more personal. "He stands down for 3 people. His handler, his trainer, his commanding officer." Claire's fingers flexed once, then folded again. "And a medic who knows the code." The words landed. Holt watched her closely as if the exact phrasing mattered. Vance cleared his throat. "Ms. Maddox, your employment file lists clinic experience in California. There is no mention of military service." Claire met his gaze. "My file lists my nursing degree and my license." "That's not what I said," Vance replied. Holt's voice stayed calm. "The code you used. That is unit-specific, not a general military command." Claire inhaled slowly. She could have lied. She could have danced around it. She could have tried to keep the mask intact. But the dog had already torn it in front of half the ER. "I served," she said. Vance's eyebrows lifted in quick surprise, then pressed together. "As what?" Claire looked at Holt. "You already know." Holt's jaw tightened. "I want to hear it." Claire kept her voice level. "Navy Hospital Corpsman, Fleet Marine Force." Ramirez's eyes shifted, and for a moment, the edge in his posture changed into something else. Recognition without warmth. A category clicking into place. Vance blinked. Navy. Holt did not react to Vance. He stayed on Claire. "Where?" Claire hesitated for a fraction of a second. Not because she was ashamed, because naming places had a way of opening doors she had welded shut. "Deployed twice," she said. Holt waited. Claire swallowed once. "Syria, then Afghanistan." Vance's mouth opened slightly, then closed. He glanced at the folder as if the paper could argue with the truth. Holt's voice stayed steady. "Time frame, 2018 to 2023, Claire said. Vance leaned back in his chair, expression sharpening into something that looked like suspicion dressed in professionalism. "So you omitted military service on your application." Claire's tone did not change. "You asked for nursing experience and credentials. I gave you those." Vance's eyes narrowed. "Why?" Claire lifted her chin slightly. "Because I wanted to be hired as a nurse." Holt watched her for a long beat. "Not as a veteran." Claire did not deny it. "Not as a story." A silence settled. It was not hostile. It was heavy with the kind of truth that makes institutions uncomfortable. Vance tapped the folder. "You also made a clinical call tonight that goes beyond typical civilian experience." Claire's eyes flicked. "I spoke up." The physician confirmed it. The physician acted. Vance's voice sharpened. "That is not the only issue. Holt stepped closer to the table, still standing a presence that shifted the room's balance away from Vance. Mark, this is not about hospital policy. This is about a Marine general, a working dog, and a code phrase that is not public. Vance's jaw tightened. This is my hospital. Holt's eyes stayed calm. And this is my chain of command. Claire watched them both. She understood this conflict. Two systems overlapping and insisting they were the only system that mattered. Holt looked back at Claire. How do you know the code? Claire answered without drama. I worked with military working dogs. I learned the command structure, the cadence, the language that tells a dog you are not a threat. Ramirez's voice softened a fraction. Which unit? Claire held his gaze. Fleet Marine Force attached. I'm not here to recite my record. Holt nodded once, accepting boundaries. We will verify. That is our job. Vance's eyes flicked to Holt. I need to verify too. HR needs to verify. The board will ask how we hired someone who did not disclose. Holt cut him off, still calm. You can verify her license and employment. You do not verify her deployments. That is military business. Vance's face flushed. You do not get to tell a civilian hospital what is or is not our business. Holt's voice did not rise. Tonight, you treated a Marine general. You are already in our business. Claire breathed slowly through her nose. She felt tired in a way that had nothing to do with the shift. Vance pushed the folder a few inches toward her. You understand you've created a liability issue. Claire looked at the folder, but did not touch it. I created a living patient. Vance's eyes hardened. You understand what I mean. Claire's voice stayed flat. I understand what you call risk. Holt watched her with something like respect that he refused to show openly. Were you honorably discharged? Yes, Claire said. Holt nodded once. All right. Vance leaned forward again. Are you refusing to cooperate with a hospital investigation? Claire looked at him. I'm cooperating with reality. You can ask questions. You cannot rewrite tonight into a policy violation just because it scares you. Vance's lips pressed into a line. We have to protect the hospital. Claire met his gaze. From what? Competence. The words landed sharp. Vance's chair creaked as he leaned back, the sound loud in the small room. Holt shifted slightly. We are done here for now. Vance blinked. Excuse me. Holt's eyes stayed on him. I am not asking. Vance looked like he wanted to argue, then caught himself. He was calculating. Not a coward. Just a man whose world ran on paperwork, not rank. Holt turned to Claire. You are not under arrest. You are not being detained. You are being asked to remain available. Claire nodded. I'm on shift. Holt's expression tightened. The hospital may change that. Claire held still. I will do whatever is required. Ramirez opened the door. The hallway noise rushed in like water. They stepped out. Tina was waiting outside, arms folded. Jamal stood beside her, restless eyes darting between faces. Tina's gaze snapped to Claire. Are you okay? Claire answered without hesitation. The patient is stable. Tina's eyes narrowed. Claire. Claire met her gaze. I'm fine. Tina did not believe it. She did not push. She turned her attention to Holt. You done? Holt nodded once, for now. Tina stepped closer, voice low. You do not take my nurse into a room and come out acting like she's a suspect. Holt's face remained controlled. She isn't a suspect. Then stop treating her like one, Tina said. Holt's eyes flicked toward ICU room 7. The general is alive. That is not nothing. Tina's jaw tightened. Neither is she. Holt did not answer. He and Ramirez walked away down the corridor, already talking quietly into a phone, already stepping into another chain of action. Claire watched them go, then turned back toward the ICU. Gunnar was still there, still guarding, still breathing in the steady rhythm of a dog who had chosen his person. Dr. Hart stood at the doorway, now arms crossed, expression unreadable. You're still on shift, Dr. Hart said. Claire nodded. Dr. Hart held her gaze. You're going to chart everything that happened in trauma. Every observation, every intervention, every call you made to me. Yes, Claire said. Dr. Hart's voice lowered. And you're going to tell me the truth when I ask something medical. I don't care where you learned it. I care that it's correct. Claire's throat moved. It was correct. Dr. Hart nodded once, then charted. Claire stepped into the ICU room. Gunner's head lifted immediately. His tail thumped once against the floor, controlled but undeniable. The ICU nurse glanced up. He knows you. Claire rested her hand on Gunner's collar, and the dog settled again. The general lay still, intubated eyes closed. Machines holding him at the edge of sleep. His face looked older now, stripped of command by pain and sedation. Claire watched his chest rise under the ventilator. She watched the blood pressure hold. She watched the saturation stay steady. She felt the strange emptiness that came after doing something urgent. The body wants another crisis to justify the adrenaline still in the veins. Tina stepped into the doorway. You have to write an incident note, she said quietly. Hospital policy. Claire did not look away from the general. I know. Tina paused, then added, Security is making noise. Claire's fingers flexed on the collar. They always do. Tina's expression softened for half a second. You didn't have to do that tonight. Claire finally looked at her. Yes, I did. A long silence passed. In it, Tina saw something in Claire that she had sensed all week and had avoided naming. Not arrogance, not drama, a kind of practiced readiness that does not come from a clinic. And Tina's voice went softer. You could have gotten hurt. Claire's tone stayed calm. He would have died. Tina exhaled. Chart. Then go home when you can. This place eats people alive when they become a headline. Claire did not answer. She turned back to the monitor and began to chart in her mind before she touched a keyboard. In the administrative wing, Monica Weller sat alone in her office with the lights dimmed. She did not like being in the hospital this late. She was an administrator, not an ER clinician. She lived on daylight and schedules and meetings that ended before dinner. Tonight had dragged her into the hour where decisions feel sharper and less forgiving. Her phone was pressed to her ear. The voice on the line was calm, practiced, and without compassion. Legal counsel. Monica, the attorney, said I've reviewed the preliminary report. Weller stared at the thin file on her desk with Claire Maddox's name on it. 7 days employed. Perfect attendance. No disciplinary notes. No personal information beyond what was required. A ghost in scrubs. She saved his life, Weller said, and she hated how defensive it sounded. This time the attorney replied, if she had been wrong, we'd be facing a catastrophic claim. Weller closed her eyes briefly. She could picture the general's face from the photos already circulating within the hospital. Pale, bloodied, barely breathing. She could also picture a courtroom, a jury, a headline. Hospitals lived inside that shadow, whether they admitted it or not. Did she act outside scope? Weller asked. The attorney exhaled. That depends on how your staff frames it. She identified a condition. A physician confirmed and treated. That part is safer. The bigger issue is the non-disclosure. Non-disclosure isn't illegal, Weller said. No, the attorney agreed, but it signals lack of transparency. And now you have military personnel claiming she used a restricted code phrase. That increases the scrutiny. Weller's eyes moved to the policy binders stacked along the wall. Compliance, risk, human resources. They looked like weapons when you were tired. What do you recommend? Weller asked. The attorney's voice stayed smooth. Administrative leave pending review. It signals you take protocol seriously. It calms insurers. It buys time. Weller's throat tightened. She's a nurse. She did what nurses do. She did what a combat medic does, the attorney said. And your hospital did not hire a combat medic. It hired a civilian nurse. The words stung because they were half true and entirely missing the point. Weller looked at the clock. It was late enough that decisions felt permanent. Fine, she said, and the word tasted like metal. Draft the language. The call ended. The office felt colder without the voice in her ear. She opened Claire's file again, flipping through pages she already knew. Competent. Quiet. No personal details. No story. No roots. Weller hated that she needed roots to feel safe. Her assistant knocked and stepped in, eyes wide from lack of sleep. The ER staff is calling her a hero, the assistant said. Dr. Hart wants to commend her. Weller did not look up. Dr. Hart does not sign liability coverage. The assistant hesitated. Monica, she saved a general. Weller's mouth tightened. She also created a situation where security almost drew a weapon in the ER. That wasn't her, the assistant protested. It doesn't matter, Weller replied, and she heard the hollowness in her own voice. It matters to insurers. It matters to the board. It matters to the hospital's survival. The assistant's eyes narrowed. So you're going to punish her. Weller stood up, walked to the window, and stared at the parking lot lit by harsh sodium lamps. The hospital looked quiet from here. Safe. Predictable. She wanted it to stay that way. I'm going to pause her, Weller said. Administrative leave pending review. The assistant's face changed. Disbelief first, then anger. That's wrong, she said. Weller swallowed. It's necessary. The assistant held her gaze for a moment, then turned and left without another word. Weller sat down and typed the email herself. Each sentence felt like it belonged to someone else. She printed the document, signed it, and placed it in an envelope, as if a paper could contain the damage it would do. Back in the ER, dawn began to press gray light against the windows. The night shift looked like ghosts' faces, pale eyes, rimmed red bodies, moving on caffeine and habit. Dr. Hart learned about the administrative leave between patients. Tina approached her near the supply room, voice low. Monica Weller put Maddox on leave. Dr. Hart stopped walking. For a moment, she just stood there, hands at her sides, staring at Tina as if the words had been spoken in another language. She saved his life, Dr. Hart said. Tina nodded, jaw tight. Liability. Dr. Hart's face hardened in a way her staff recognized immediately. She turned and walked toward the break room without asking permission from anyone. The break room filled quickly. Nurses coming off shift lingered instead of leaving. A resident wandered in with coffee he did not drink. Jamal stood near the sink, staring at the wall like it might offer a solution. Dr. Hart walked to the center of the room and spoke without raising her voice. We are not going to sit here while they make her a scapegoat, she said. A nurse near the table frowned. They say she acted outside scope. Dr. Hart's eyes flashed. She spoke up. I confirmed it. I acted. If anyone overstepped, it was me, and I will say that to the board. Tina crossed her arms. Monica thinks this protects the hospital. Dr. Hart's mouth tightened. It protects paperwork. It does not protect patients. Jamal finally spoke, voice raw. She's been solid all week. She caught a medication error on her third day. Another nurse nodded. She stayed late to help with a code that wasn't even hers. A tech added, she's careful. She's not reckless. The stories came out in small bursts. Not grand heroics. Quiet competence. Moments that did not seem dramatic until you stacked them together and saw the pattern. Dr. Hart listened, then said, we write it down. Tina's eyes narrowed. You're going over Monica. Dr. Hart held her gaze. I'm going around her. She pulled out a notepad and began drafting a letter with language that was clinical and unflinching. Claire Maddox acted within her expertise to protect a patient. Her experience improved outcomes. Punishing her undermines staff willingness to speak up. The hospital's public support of veterans must be reflected in policy. She looked up. If you agree, you sign. Hands went up, not slowly, not cautiously. Every hand in that room rose, including residents who usually stayed out of administrative conflict, including techs who had never signed anything in their lives. Tina hesitated for one breath, then lifted her hand too. Jamal's hand was already up. Dr. Hart's pen moved faster. A resident pulled out his phone. I'll post it on Slack. Get more departments. Tina shot him a warning look. No patient names. He nodded. No names, just principle. Within an hour, the letter had dozens of signatures. The message circulated through the hospital's internal channels like heat. People forwarded it. People added their names. People who rarely agreed on anything were suddenly aligned, not because they were sentimental, but because they were tired of watching institutions punish the wrong person. Someone somewhere wrote one sentence online from a personal account. No names, no details, but enough to ignite curiosity. A hospital punishes the nurse who saved a life. That was all it took. By late morning, the hospital's main line began to ring non-stop. Some callers were polite. Some were furious. Many were veterans. Mark Vance watched the call logs stack up and felt his stomach tighten. Crisis did not feel like a press release. It felt like being outnumbered by voices you could not see. Weller's office shifted into a different kind of chaos. Not the controlled panic of trauma medicine, but the corporate version phones ringing, emails flooding in, staff whispering in hallways. A reporter left a voicemail asking for comment about a veteran nurse and a Marine general. Weller listened to the message twice, face tight. She rubbed her forehead, trying to keep her anger from turning into fear. She opened Claire's file again. 7 days, no problems. Then one night that detonated every assumption. At home, Claire sat at her small kitchen table with her badge and her stethoscope laid beside a half-finished cup of coffee. She had gotten home after sunrise and showered until the water ran cold, trying to rinse off a feeling that was not dirt. Her hands were steady, but her body felt hollowed out, like the adrenaline had taken something with it when it left. Her phone buzzed repeatedly. Messages from Jamal, from Tina, a missed call from an unknown number. She did not open any of them at first. She stared at the wall. Reno's morning light came through the blinds in thin stripes, turning the room into a pattern of shadow and glare. A knock came at the door. One short knock, then another. Claire's muscles tightened before she stood. She opened it to find a hospital courier holding an envelope. "Claire Maddox," the courier asked. "Yes," she said. He handed her the envelope and left without looking her in the eye. Claire shut the door and stood in her kitchen with the envelope in her hand. The paper felt heavier than it should. She opened it slowly. Administrative leave pending review. The words were clean. The language was polite. The meaning was sharp. Claire read it once, then folded it and set it on the table without emotion. She had expected consequences. She had just hoped the hospital might hesitate long enough to see her as a person before it reduced her to risk. Her phone rang again. This time, she answered without looking at the screen. "Tina," she said. Tina's voice came through tight and fierce. "Don't you dare disappear." Claire closed her eyes. "They put me on leave." "I know," Tina said. "Dr. Hart is furious. The whole ER is behind you." Claire's throat tightened. "I didn't want this." "I know you didn't," Tina replied. "But you don't get to control what a hospital turns into when it's scared." Claire stared at the envelope. "I just wanted to work." Tina's voice softened slightly. "Then let us work for you now." Claire did not answer. She did not know how to accept that kind of loyalty in a civilian life. Loyalty in uniform came with structure. Here, it felt like stepping onto ice that might not hold. Another voice came on the line. "Jamal." "Claire," he said, and the way he said her name sounded like apology. "They're blowing this up." Claire kept her eyes on the table. "They always do." Jamal inhaled. "People are calling. Veterans groups. Somebody posted about it. Monica Weller is in full crisis mode." Claire's jaw tightened. "I didn't ask anyone to post." "I know," Jamal said. "But people saw you save a man and then get treated like a problem. That doesn't sit well." Claire's voice stayed calm, but it carried steel. "It never sits well until it becomes inconvenient." Tina cut in. "We signed a letter. A lot of us. Dr. Hart is taking it to the board." Claire's fingers pressed lightly into the tabletop. "That will make it worse." "It will make it visible," Tina replied. Claire's chest tightened. Visible was the thing she had been avoiding since the day she walked into Crescent Valley. After the call ended, Claire sat for a long time without moving. The silence in her apartment was different from the silence in the hospital. Here, it was empty. In the hospital, it was loaded, waiting for someone to speak. Her phone buzzed again. Another unknown number. She let it ring twice, then answered. "This is Monica Weller," a woman said, voice controlled. "Hospital administration." Claire's posture straightened. "Yes. You received notice of administrative leave," Weller said. Claire glanced at the envelope. "Yes." Weller continued. "You are not to return to the premises until the review is complete." Claire's voice stayed even. "The general is still there." A pause. "The general is stable." Claire felt something sharp and private behind her ribs. Stable did not mean safe. Stable was a word administrators used to end conversations. Weller's voice softened slightly, an attempt at humanity that did not quite land. This is not punitive. It is procedural. Claire let a silence pass. Procedures nearly killed him. Weller inhaled. You understand why this is happening. Claire's eyes narrowed. Because you're afraid. Weller's tone tightened. Because we have obligations. Claire did not argue. She had learned long ago that you cannot reason someone out of fear when fear protects their paycheck. Understood, Claire said. Weller paused, then added, Security and military personnel have also raised concerns about a code phrase you used. Claire's jaw set. I kept people from getting hurt. Weller's voice sharpened. You brought another layer of scrutiny to this hospital. Claire's reply was quiet. Your hospital brought that scrutiny in when it tried to pull a gun in the ER. Weller's breath caught. That is not an appropriate statement. Claire's face stayed blank. It's accurate. The call ended with a cold politeness that felt like a door closing. Claire stared at the phone for a moment, then set it down. In ICU room 7, General Rourke's eyelids fluttered open later that afternoon. The ventilator had been removed. His voice was rough now, scraped raw by tubing and pain. His gaze moved slowly across the room, measuring what he could. Gunnar lifted his head immediately. His tail thumped once against the floor, controlled but unmistakable. A nurse adjusted the IV drip and spoke softly. Welcome back, General. Rourke's eyes narrowed slightly as he tried to focus. Where's my dog? He rasped. The nurse glanced toward Gunnar. Right there. Rourke's gaze landed on the German shepherd, and something in his face eased. He reached one hand down slowly. Gunnar rose and pressed his head into the general's palm, then sat again, guarding the bed, without obstructing the nurse's work. Rourke's eyes shifted toward the door. The nurse, he said. The one he listened to. The nurse blinked. Which nurse? Rourke's voice carried a hint of impatience even through pain. The new one. The ICU nurse stepped into the hallway and found Dr. Hart. He's asking for the nurse who handled the dog, she said. Dr. Hart's face tightened. Claire Maddox is on administrative leave. The ICU nurse stared. He's asking. Dr. Hart exhaled slowly. Fine. She made a call. Then another. Chains of permission and liability and rank collided in the air. By evening, Claire's phone rang again. It was Tina. He wants to see you, Tina said, voice low. Claire's fingers tightened around the phone. Who? Tina replied, as if Claire had become slow. The general. He asked for you. Claire stared at the envelope on her table. I'm on leave. Tina's voice went harder. He doesn't care. Claire swallowed. Monica Weller will. Tina exhaled. We'll handle Monica. Claire closed her eyes. She felt the pull of two-world civilian paperwork on one side and a man who had almost died on the other. I'll come, she said quietly. When Claire returned to Crescent Valley that night, the hospital felt different. Not just the staff whispers. Not the phones ringing. The building itself felt alert, like it knew it had stepped into something larger than its own routines. Mark Vance met her at the entrance with a tight expression. He looked ready to turn her away, then saw the Marine escort beside her, and his jaw tightened further. You're not cleared, Vance said. The Marine did not argue. He simply showed a name and a message on his phone. A request from the ICU. A request from a general. Vance's face changed in slow frustration as he realized policy had just been outvoted by reality. Claire walked past him without speaking. In the elevator, the fluorescent light made her look pale. She kept her hands at her sides. No badge on. No stethoscope. Just a person walking back into the building that had tried to push her out. The ICU hallway was quiet. The air was colder here, cleaner. The monitor beeps sounded like distant metronomes. She approached room 7. Gunnar's head lifted immediately. His tail thumped once, then again. Claire stepped inside and stopped just inside the doorway, respecting the dog's space the way she had in the ER. Rourke lay propped up against pillows, bruised and pale. His eyes were sharp, despite medication. The kind of eyes that had spent decades reading rooms. He looked down at Gunnar as the dog rose and approached Claire, then sat at her feet like he had made a decision. Rourke's mouth twitched a thin hint of amusement. He likes you, he rasped. Claire kept her face neutral. He follows commands. Rourke's eyes narrowed slightly. He follows authority. Not many people have it. Claire met his gaze and did not look away. You should rest. Rourke let out a rough breath that might have been a laugh if it had not hurt. That code, you spoke, he said. Not civilian. Claire did not answer. Rourke watched her carefully, then said Fleet Marine Force. Claire's throat tightened. They told you. They told me enough, Rourke replied. They didn't have to. Gunner did. Claire's gaze dropped briefly to the dog, then returned to the general. Rourke's voice softened, still rough. I've met a lot of people trying to leave it behind. Claire held still. I'm a nurse. Rourke nodded, as if conceding a point. You are. He studied her for a moment longer, then said, Where were you stationed? Claire's jaw set. That's not why I'm here. Rourke's eyes sharpened. You're here because I asked. Claire breathed slowly. You're alive. That's enough. Rourke's hand tightened on the blanket. You saved me. Claire did not respond to the praise. Praise felt like a hook. Rourke continued, voice quieter, more precise. You saw the lung. Claire's eyes flicked. I saw the pattern. Rourke nodded slowly. That's not something you learn in a clinic. Claire's voice stayed calm. You don't have to understand it. Rourke's gaze did not soften. It held. I do. A long silence settled. In it, the ICU machines hummed. Gunner's breathing was steady and warm against Claire's shoes. Rourke spoke again, slower. I retired last week. Claire's eyes flicked to him. The sentence mattered. Not because of the retirement. Because of what it implied. He had been on his way out of command. He had been between identities, too. Rourke's eyes stayed on her. I've seen what happens when people with your kind of experience get shoved into the corners. Claire's voice remained flat. I chose the corner. Rourke shook his head slightly, then winced. No, you chose quiet. The world chose the corner for you. Claire did not answer. Rourke breathed through the pain and kept speaking. A hospital like this doesn't know how to hold veterans. It doesn't know how to read them. It doesn't know what they bring into the room. Claire's jaw tightened. This hospital doesn't want what I bring. Rourke's voice sharpened. Then it needs to learn. Claire looked down for a fraction of a second, then back up. They put me on leave. Rourke's eyes narrowed, I heard. Claire waited. Rourke's voice dropped calm and certain. I will speak to the board. Claire's shoulders stiffened. You shouldn't. Rourke's mouth tightened. I almost died on their floor. They're already in my business. Claire's voice stayed steady. This will turn into a fight. Rourke's gaze held hers. It already is. Claire felt the words land like weight. She had wanted to stay invisible. The hospital had made her visible by punishing her. Visibility did not come as a medal. It came as exposure. Rourke looked down at Gunner, then back at Claire. You did what you were trained to do. Claire's fingers flexed. I'm trained to care for patients. Rourke nodded once. Exactly. Outside the room, footsteps paused. Dr. Hart stood in the hallway listening just long enough to confirm the general's tone. She did not enter. She let the moment belong to Claire. Claire finally spoke, voice low. Why did Gunner stand down for me? Rourke's eyes narrowed as he considered. Because he recognized you before the hospital did. Claire looked at the dog. Gunner looked back, steady, patient, unjudging. A nurse entered briefly to check vitals, then left. The room returned to quiet. Rourke's voice softened again. I'm starting an outreach program when I'm out of here. Veterans' health, not speeches. Real work. Claire's throat tightened. I'm not looking for a program. Rourke nodded, understanding more than she wanted him to. You're looking for peace. Claire did not answer. Rourke watched her face, then said, Peace doesn't mean pretending you never learned how to save people. Claire's jaw clenched, then eased. I came here to be a nurse. Rourke's eyes held. Then be one. Fully. Claire stood still. She did not accept the invitation. She did not refuse it. She simply absorbed it like a medic receiving new orders while still carrying the old ones. Rourke's eyelids lowered slightly as fatigue pressed in. Go, he said, before your administrators find a new way to be frightened. Claire turned toward the door. Gunnar rose instantly and stepped with her, then paused and looked back at the general as if asking permission. Rourke lifted his hand weakly. Gunnar returned to the foot of the bed and lay down again. Claire stepped out into the hallway. Dr. Hart was there now, leaning against the wall, arms crossed. "You talked to him," Dr. Hart said. Claire nodded. He asked. Dr. Hart's eyes narrowed. "Did he mention the board?" Claire did not answer directly. "He's awake." Dr. Hart's mouth tightened. "Then Monica Weller is going to have a long day." Claire stared at the floor for a moment, then lifted her gaze. "I don't want this to be about me." Dr. Hart's expression hardened. "It's about the hospital deciding whether it punishes the people who notice what others miss." Claire held her gaze. They already decided. Dr. Hart did not blink. "Then we changed their minds." Downstairs, phones continued to ring. Emails continued to pile up. Weller's assistant carried printouts of social media posts into the office like incoming fire. Mark Vance paced in the security suite, jaw tight, listening to voicemails from veterans groups demanding explanations. In the late afternoon, Weller sat in a conference call with the board chair, her voice controlled and her hands trembling slightly under the desk, where no one could see. "We need an emergency session," the chair said. Weller stared at Claire's file on the table in front of her, the thin folder that had become the center of everything. "When?" "Today," the chair replied. Weller exhaled slowly. "Understood." She ended the call and looked at the window again. The parking lot was bright now, ordinary. Inside the hospital, the air felt charged, as if the building itself were waiting for a verdict. She gathered the file, the policy binders, the incident reports, and the letter from the ER staff with dozens of signatures. She stacked them neatly as if neatness could control the outcome. Then she stood and walked toward the boardroom where the lights had already been turned on. Monica Weller walked with the file pressed against her ribs, as if keeping it close could keep it contained. The hallway to the boardroom smelled faintly of lemon cleaner and burnt coffee. Staff stepped out of her way without being asked. Not from respect. From attention. People watched her like the decision had already happened and they were just waiting to see what shape it took. The boardroom sat on the second floor behind a frosted glass door with a polished metal handle that looked too calm for the hour. Inside, the lights were bright and flat. A long table filled the center. Bottled water sat untouched at each seat. A whiteboard on the far wall still carried faint marker lines from a previous quarter's budget review. Now the table held different objects, a stack of policy binders, an incident report, a printed screenshot of a voicemail transcription, a copy of the ER staff letter signatures crowding the bottom like a tide. Mark Vance stood near the wall with his arms folded. He had his security coordinator face on the one he wore when he was talking to lawyers. Weller's legal counsel sat on speakerphone, a calm voice, waiting in the room without a body. The board chair, Richard Halpern, sat at the head of the table. He was a man who spoke in measured sentences and thought in risk calculations. On his right sat Dr. Priya Nandakumar, the hospital's medical director, eyes sharp behind thin framed glasses. On his left sat Samuel Keene, older than the others, shoulders set in a way that hinted at a lifetime of habits that never left. Two more members sat farther down, a finance executive named Laura Finch and a community representative named Daniel Sato. They looked up as Weller entered. Halpern gestured to the chair nearest him. "Monica." "Start." Weller sat. She placed the file on the table and opened it. The paper made a soft sound too small for the tension it carried. Last night, she began, voice steady, Crescent Valley received a trauma patient who was identified as Lieutenant General Malcolm Rourke, United States Marine Corps. The patient arrived with military personnel and a working dog. The staff encountered an access problem due to the dog's behavior. Dr. Nandakumar's gaze flicked to Vance. Access problem. Vance's jaw tightened. The dog prevented staff from approaching within 6 feet. A security guard nearly drew his weapon. Laura Finch's eyebrows lifted. Nearly. Vance nodded once. "That is correct." Weller continued. "During treatment, one of our nurses, Claire Maddox, gave a command that caused the dog to stand down. Later, she made a clinical observation that led to the physician diagnosing and treating a left-sided tension pneumothorax prior to surgery. The patient survived." Daniel Sato leaned forward. "So she did the right thing." Weller's mouth tightened. She did an effective thing. The question is whether the hospital can endorse the pathway that led there. Halpern's eyes stayed on the paperwork. She is new. 7 days employed, Weller said. No disclosed military background. No disclosed exposure to combat medicine. Her file lists civilian clinic work. Samuel Keene's expression did not change. The file is not the person. Weller held his gaze. The board has to operate on what is documented. Dr. Nandakumar lifted the ER letter. The staff states she acted appropriately, that she escalated to the physician, and the physician confirmed. Weller nodded. Dr. Hart confirmed. The physician acted. That reduces some exposure, but we have additional issues. She slid a page forward. First, non-disclosure. Second, a unit-specific code phrase spoken in our ER that military personnel indicated is not public. Third, the perception of the hospital allowing armed confrontation on the floor. Fourth, the media attention and the veteran community response. Halpern tapped the table lightly. Your recommendation. Weller's throat tightened. She thought of the phone call with legal counsel, the word necessary, the cold neatness of administrative leave. Administrative leave, pending review, she said. Not termination, not discipline. A pause to investigate scope concerns, disclosure concerns, and develop protocols for military working animals and military patients. Daniel Sato frowned. The public will see it as punishment. Weller met his gaze. The public is not liable for the next adverse event. We are. Dr. Nandakumar's voice was clinical. She did not perform the procedure. She advised. The physician verified with ultrasound and acted. Weller nodded. That is why leave is appropriate rather than termination. It signals we take oversight seriously without deciding guilt. Laura Finch's fingers tightened around her water bottle. The calls have been non-stop. Vance spoke. We have veteran organizations asking if the hospital is hostile to veterans. We have a reporter asking for comment. We have staff agitation. Samuel Keene looked at Weller. Agitation is a mild word. Your ER has signatures on a letter like a petition. Weller kept her face neutral. The staff is emotional. Dr. Nandakumar's eyes sharpened. They are tired. There is a difference. Halpern lifted a hand. We are not here to debate feelings. We are here to manage risk. The speakerphone clicked as legal counsel spoke. From a risk perspective, administrative leave is the correct first step. Samuel Keene's gaze shifted to the speakerphone as if he could stare through it. And from a human perspective, legal counsel paused. Human perspective does not appear in court filings. The room held a tight silence. Then the door opened. It did not slam. It did not crash. It simply opened, and the shift in the air was immediate, as if the boardroom had been holding a private conversation and suddenly realized it was not private. A man stepped into the doorway in full dress uniform, ribbons lined across his chest like a ledger of survival. He leaned lightly on a cane. His movements were slower than the rank on his shoulders suggested, but he did not hesitate. At his side walked Gunnar. The German shepherd's paws made soft clicks on the polished floor. His vest was on clean now, but the name patch still read the same. He moved with calm authority, head-level eyes, scanning the room with the same discipline he had shown in the ER. He stopped when the man stopped. He sat when the man sat. Staff Sergeant Holt and Corporal Ramirez stood just outside the door, visible enough to register, restrained enough to avoid overt dominance. They were not escorting in a threatening way. They were present as a statement. Halpern rose halfway, then froze, unsure whether to stand fully. Laura Finch's eyes widened. Daniel Sato stood without thinking. Dr. Nandakumar's expression held steady, but her hands tightened on the letter. Weller felt her stomach drop. General Rourke looked around the table, meeting each face in turn. His voice was rough, still healing, but it carried weight without volume. I hope I'm not interrupting, he said. Halpern cleared his throat. General. With respect, this is a hospital board session. Rourke nodded once. I'm aware. He took a step forward and placed one hand on the back of a chair, steadying himself. Gunnar stayed beside him, calm. I'm the patient you're discussing, Rourke said. I assumed I should be present. Weller found her voice careful. General, this is a personnel matter. Rourke's eyes turned toward her. They were sharp, even through pain. And I'm personnel. He glanced down at Gunnar. So is he. A silence spread across the room like a slow stain. The speakerphone stayed quiet. Halpern gestured toward a chair. Please, General, sit. Rourke did not wait for the gesture to become permission. He sat. Gunnar sat near his right leg posture, steady eyes alert. Weller's mind ran through policy like a reflex, but policy had nothing for a wounded Marine general in dress uniform in the boardroom. Rourke rested his hands on the table. His fingers were bandaged. The back of his hand carried bruising from IV lines. The uniform did not hide the fact that he had been cut open and stitched together. I've led Marines for 3 decades, he said. I know what competence looks like. I also know what courage looks like. Last night, your nurse had both. Halpern's face tightened into polite neutrality. We are not questioning her intent. Rourke looked at him. That's good, because intent kept me alive long enough for your system to catch up. Dr. Nandakumar spoke calm. General, there are concerns about process. The hospital has obligations. Rourke nodded once. Obligations. I understand obligations. I spent my life living inside them. He leaned forward slightly, cane resting against his knee. Your process would have killed me. Weller's jaw tightened. General, that is not a fair statement. Rourke's gaze held. It's accurate. The words landed cleanly without drama. He did not raise his voice. He did not threaten. He stated a fact, with the certainty of someone who had watched people die, because they were slower than the situation demanded. Laura Finch cleared her throat. General, we are grateful you survived, but you must understand liability. Rourke's eyes moved to her. I understand liability. I understand reputational risk. I understand institutions that choose the safest-looking move instead of the right one. Weller felt heat rise under her collar. We are not punishing her. Rourke's voice stayed calm. Administrative leave for a nurse who saved a life is punishment in a suit and tie. Vance shifted near the wall. General, there was a safety issue. A dog threatened a physician. Rourke's head turned toward Vance. My dog did not threaten your physician. My dog enforced a perimeter because he was trained to protect me. Your staff did not know how to approach a working dog. Your security nearly escalated it to violence. Vance's face flushed. We operate under policy. Rourke nodded once. Policy is not a shield for ignorance. Dr. Nandakumar's voice was controlled. General, there is also the issue of non-disclosure. She did not disclose her service. Rourke's gaze shifted back to the table. Does this hospital require employees to list every chapter of their life, or only the chapters that make administrators uncomfortable? Halpern's lips pressed together. Disclosure helps us assess fit. Rourke's eyes narrowed slightly. Fit for what? For saving lives. Daniel Sato spoke quietly. The community response is intense. Rourke looked at him. Because the community understands something you're trying to reduce to policy. Veterans bring skills. They also bring silence. Sometimes silence is survival. You punish that silence, you tell every veteran in this city they are welcome only if they are easy to manage. Weller felt the board's attention shifting. She tried to keep the frame anchored in risk. General, she said carefully. Nurse Maddox spoke a unit-specific code phrase. Military personnel indicated it is not public. That alone triggers scrutiny. Holt's voice came from the doorway, respectful and firm. Ma'am, the phrase indicates authority recognition for the dog. It is not a broadcast secret. It is a command structure. Weller's eyes flicked toward him. It is not for you to decide what is relevant to hospital risk. Rourke lifted a hand, slightly quieting the edge. The nurse used the phrase to prevent your staff from being injured and to allow treatment. It worked. Halpern leaned forward. General, you cannot dictate staffing decisions. Rourke met his gaze. I can dictate what I speak to my community. I can dictate where my donations go. I can dictate which hospitals I recommend to every veteran organization that has already called your front desk today. The room tightened. It was not a threat. It was leverage stated in plain language. Laura Finch's eyes flicked to the speakerphone. Legal. The attorney's voice came through carefully. General, with respect, waiver of liability from a patient does not necessarily eliminate institutional exposure. Rourke nodded once. Then don't rely on a waiver. He turned back to Halpern. Rely on competence. Rely on training. Use what happened last night to build a protocol that keeps your staff safe and your patients alive. Or you can punish the person who saw what your system missed. Samuel Keene finally spoke again, voice low. I'm a veteran. Heads turned toward him. Keene's eyes stayed on Rourke, Vietnam. Rourke nodded acknowledgement, passing between them without sentimentality. Keene looked at Halpern. If the general had died because we couldn't get past a dog, we'd be in front of cameras today, explaining why our policies were more important than a human life. We got lucky. Dr. Nandakumar's eyes narrowed, lucky. Keene's voice stayed steady. Lucky that the nurse knew what to do. Lucky that the physician listened. Lucky that the dog recognized her voice. You want to call that a liability? I call it an asset. Halpern's jaw tightened. We cannot ignore process. Rourke leaned back slightly, pain crossing his face for a moment, then smoothing out. Then improve your process. Don't destroy the person who revealed its gaps. Weller felt her control slipping. She did not like being outflanked in her own boardroom. She also could not deny the reality the general was alive, and the nurse's decisions were part of why. Halpern folded his hands. General, what are you asking? Rourke did not hesitate. Lift the administrative leave. Issue a statement acknowledging her actions were appropriate within the chain of care. Build a training program for military-specific trauma and military working dog protocols. Make her part of it. Weller's eyes flicked to the file. We do not know her full background. Rourke's gaze held. You know she saved my life. Halpern looked around the table. We need to speak with the nurse directly. Weller's throat tightened. She is currently on leave and not cleared to return. Rourke's mouth tightened. She was in my ICU room today. Weller felt heat rise. That was not authorized through administration. Holt's voice came from the doorway, calm. It was authorized by the patient. Halpern's expression shifted, irritation flickering. Bring her in. Weller's mind moved fast. Bring her in now in this atmosphere with the general present, with staff signatures, with phones ringing downstairs. The board was already changing shape. Ramirez stepped away from the doorway. A few minutes later, Claire Maddox entered. She wore simple clothes, not scrubs. No badge, no stethoscope. Her hair was pulled back neat and restrained. She looked like someone who had learned how to take up as little space as possible. Yet as she stepped into the boardroom, her posture stayed steady. She did not shrink. She did not inflate. She stood. Gunner's ears twitched, though he remained seated beside the general. His tail tapped the floor, once quiet but unmistakable. Claire stopped a few feet from the table. She did not glance around with curiosity. She met the room like she had met the trauma bay, measured calm eyes, tracking details without advertising it. Halpern gestured toward an empty chair. Ms. Maddox, thank you for coming. Claire did not sit. I was asked. Weller's mouth tightened. You are on administrative leave. Claire looked at her face, neutral. Yes. Weller slid the incident report toward the center of the table. We need to review your actions. Claire's eyes flicked to the paper, then back to Weller. My actions were to prevent injury and keep a patient alive. Weller's tone sharpened. You used a unit-specific command. You did not disclose your military background. You inserted yourself into clinical decision-making beyond your role. Dr. Hart's voice came from the doorway where she had arrived quietly and stopped. She escalated. I confirmed. I acted. Halpern glanced toward Dr. Hart, then back to Claire. Ms. Maddox, are you a veteran? Claire held steady. Yes. Halpern's voice remained controlled. Why did you not disclose that? Claire's answer came clean. Because I wanted to be hired as a nurse. Weller's eyes narrowed. And you believe the hospital would not have hired you otherwise. Claire did not look away. I did not want my resume to be treated like a story. Keene leaned forward slightly. You were a corpsman. Claire's jaw tightened for a fraction of a second, then smoothed. Yes. Halpern tapped a pen once. Do you understand why non-disclosure concerns us? Claire's voice stayed calm. I understand why unpredictability concerns institutions. Weller's tone turned cold. This is not philosophy. This is policy. Claire's gaze stayed on Weller. Policy didn't stop the general's blood pressure from falling. The room tightened. Rourke watched Claire with a commander's focus, not indulgent, not sentimental. Gunner stayed still, eyes moving between Claire and the people at the table. Halpern exhaled slowly. Ms. Maddox, the board has discussed options. We would like to offer a resolution. Weller's face changed, slightly surprise flickering. She had expected the board to confirm her leave decision. The general had altered the calculus. Halpern continued. We would like you to remain employed at Crescent Valley. Claire's face did not change. She waited. Halpern's voice stayed even. Not only as a staff nurse, we want to create a veterans clinical liaison and military trauma training program. You would lead it. Claire's eyes held steady, but something moved under her calm attention that did not belong to professional detachment. The offer was not a reward. It was a spotlight. Weller watched Claire closely. The role would include staff training on military-specific trauma patterns, coordination with local veteran organizations, and a protocol framework for military working animals in clinical settings. Claire spoke quietly. That is not why I came here. Halpern nodded once. We understand you wanted to work quietly. The hospital's situation requires something else. Claire's gaze flicked to Rourke for a fraction of a second, then returned to Halpern. I want to be a nurse. Dr. Nandakumar leaned forward. This is nursing. It is education and advocacy and clinical translation. Claire held still. You are offering me a role because you discovered what I am. Keen's voice was low. We're offering you a role because you showed us what you can do. Weller's jaw tightened. It also addresses risk. Training reduces risk. Claire looked at her. So this is still about risk. Weller did not deny it. Hospitals survive by managing risk. Claire's voice stayed calm. Patients survive by managing reality. Halpern lifted a hand, trying to keep the temperature from rising further. Ms. Maddox, before you respond, we need clarity on one point. Claire waited. Halpern asked, if you had disclosed your military service in the interview, would you still have been hired? Silence spread across the table. Weller's eyes shifted. Dr. Nandakumar looked down briefly. Laura Finch pressed her lips together. Daniel Sato stared at his hands. Keen watched Weller with a steady expression that offered no rescue. Claire's face remained neutral, but her breathing slowed further, as if she had braced for this moment long ago. Halpern looked to Weller. Weller held the silence for a beat too long, then spoke. I don't know. Claire nodded once slow. Then I'm glad I didn't tell you. Weller's eyes sharpened. You're admitting you deliberately withheld information. Claire's voice stayed even. I'm admitting I needed you to see me as a nurse first. Rourke's gaze held on Weller. And you did. Weller's jaw tightened. Claire looked back at Halpern. I appreciate the offer. Halpern's shoulders eased slightly. Good. Claire continued, I will accept it with a condition. The room tightened again. Weller's eyes narrowed. A condition. Claire's tone remained calm, but it carried a firmness that did not ask permission. No marketing. Daniel Sato blinked. Excuse me? Claire looked at him. Do not use my service as a slogan. Do not post my story without my consent. Do not put veterans on posters and then treat them like liabilities in meetings. Weller's face tightened. We are not a propaganda machine. Claire's eyes did not move. Then don't become one. Halpern leaned forward. What else? Claire's voice stayed precise. Mandatory training for the ER, ICU surgery and security. Military working dog protocols. Clear chain of command contact points. A direct coordination line with base medical for military patients. A policy that protects staff who escalate concerns in good faith. Weller's eyes flicked to Dr. Nandakumar. We already have escalation. Claire's tone was quiet. You also have punishment for visibility. Weller's face flushed. That's not fair. Claire held her gaze. It's accurate. Halpern's expression tightened. Ms. Maddox, you're asking for structural change. Claire nodded. I'm asking for the hospital to stop treating competence as a risk. Keen leaned back slightly, eyes on Halpern. That's a clean condition. Laura Finch exhaled slowly. It will cost. Dr. Nandakumar spoke voice clinical. Training costs less than litigation. Protocols cost less than injury. Weller's lips pressed together. She could see the board turning toward acceptance. Halpern looked at Weller. Monica. Weller's throat tightened. She did not like being cornered. She also knew the hospital could not win a fight against the general's influence and the staff's solidarity and the veteran community's attention. She had chosen the safe move and found it was not safe at all. Agreed? Weller said the word clipped. Claire did not soften. In writing. A silence. Halpern nodded once. In writing. Weller's jaw tightened, but she did not argue. Halpern folded his hands. Administrative leave will be lifted immediately. The incident review will be reframed as a protocol improvement review, not a disciplinary investigation. Ms. Maddox will remain employed and will assist in developing this program with oversight from Dr. Nandakumar and Dr. Hart. Dr. Hart's eyes remained hard, but there was relief underneath, held back by exhaustion. Rourke leaned back slightly. Pain crossed his face and then receded. Gunnar stayed still, calm. Weller looked at Claire. You understand you will be visible. Claire's gaze held. I understand you will be accountable. The room stayed quiet for a beat, absorbing the shift. Halpern cleared his throat. General, thank you for your perspective. Rourke's voice stayed rough, but controlled. Thank your nurse. Halpern nodded once, then looked at Claire. Ms. Maddox. Claire remained standing, yes. Halpern's tone softened slightly, as much as a board chair could soften, without surrendering posture. We want you here. Claire held his gaze and nodded once. No smile, no performance. Then build what you just promised. Rourke pushed his chair back slowly and stood with his cane. Gunnar rose with him in perfect synchronization. Weller watched them, the reality of what had happened settling in. A civilian institution had just been forced to adjust its spine. As Rourke turned toward the door, he looked at Claire. You did what you were trained to do. Claire's voice stayed quiet. I did what he needed. Rourke nodded once. Gunnar's eyes flicked to Claire, steady, then back to the hallway. They left. Holt and Ramirez fell in behind them, the door closing softly. The boardroom exhaled as if it had been underwater. Weller gathered her papers with hands that stayed controlled, but moved slightly faster than usual. She looked at Claire again, and for a moment, something like doubt flickered across her face. Miss Maddox, she said. Claire waited. Weller's voice stayed formal. We'll schedule meetings to define the program. Claire nodded once. You will also schedule training for security. Vance's jaw tightened. Security is trained. Claire's eyes flicked to him. Not for this. Vance's face flushed, but he said nothing. Dr. Hart stepped into the boardroom fully now. She looked at Halpern, then at Weller, then at Claire. Come back to the ER, Dr. Hart said. Claire's throat tightened slightly. Tonight. Dr. Hart nodded. Tonight. Tina Wu stood just outside the room, arms folded, eyes sharp. When Claire walked out, Tina's posture eased a fraction. You okay? Tina asked. Claire looked at her, and for the first time in hours, her voice carried something softer than control. I'm employed. Tina exhaled. Good. Jamal stood down the hallway, hands in his pockets, face tired. When Claire approached, he looked at her like he had been holding a question for days. You're staying, he said. Claire nodded. Jamal let out a breath. People signed that letter fast. Claire's voice stayed quiet. I saw. Jamal's eyes flicked away, then back. You never asked us to. Claire's face remained neutral. You didn't need permission. Jamal nodded slowly. No, we didn't. That night, Claire returned to the ER. The building looked the same. The waiting room chairs were still worn. The fluorescent lights still hummed. The triage desk still held coffee stains. Yet the way people looked at her was different. Not awe, not celebrity. Something steadier. Respect carries a different weight than attention. It is quieter, but it changes how a room breathes. In Trauma Bay 1, Tina handed Claire a chart without ceremony. Room 5 is vomiting. Room 8 is chest pain. And there's a veteran in triage refusing to be touched. Claire nodded once. I'll take triage. Tina's eyes narrowed. You don't have to prove anything. Claire met her gaze. I'm not proving. I'm working. She walked to triage. The veteran in the chair had his arms crossed tight, jaw-locked eyes scanning the room like it might turn on him. When Claire approached, she did not rush. She stopped at a respectful distance. "I'm Claire," she said. "I'm going to ask questions. Before I touch you, I'll tell you." The veteran's eyes narrowed. "You military." Claire's voice stayed calm. "I'm a nurse." The veteran studied her face, then nodded once, shoulders lowering a fraction. Across the hall in ICU Room 7, General Rourke slept under medication recovery, slow and stubborn. Gunnar lay at the foot of his bed, head up, eyes open. When the ICU nurse walked in with meds, Gunnar watched her hand, then looked away, as if he had accepted the routine. Word spread through the hospital, then beyond it. Not as a scandal anymore, as a change. The program took shape in weeks instead of months because the pressure demanded it. Meetings happened with more urgency than anyone liked to admit. Dr. Nanda Kumar brought clinicians and security into the same room and made them speak the same language. Vance sat stiff-backed through training and said little, but he listened. Claire sat at the table with a notebook and a steady gaze. She did not decorate the conversation with stories. She spoke in protocols and patterns in the reality that blast injuries hide and working dogs read fear like a scent. She taught security how to approach a military working dog without turning the handler's animal into a cornered weapon. She taught nurses how to recognize the subtle signs of pressure building where it should not. She taught residents that the obvious wound is often a distraction and that insisting on being right is more dangerous than admitting you missed something. 3 months later, the hospital ran on the same urgency, but the seams were stronger. On a Tuesday night, Claire stood in a small classroom off the ER hallway whiteboard, behind her a group of nurses and residents, seated with coffee and tired eyes. She spoke without theatrics. "Blast injuries don't always show you the worst damage," she said. "Sometimes the body hides it until it can't." A resident raised a hand. "How do you tell the difference between anxiety breathing and something like a developing pneumothorax?" Claire looked at him, then at the group. "You watch the pattern. You listen to what doesn't fit." She described the rhythm of oxygen saturation that climbs and slips. The asymmetry that feels too small to matter until it suddenly matters. The way a patient guards a side that looks clean. She did not say Afghanistan. She did not say Syria. She did not need to. The knowledge spoke through the precision. After the session, Tina handed her a new badge holder. It had a small pin attached, subtle and plain. Not a recruitment poster, not a slogan, just a mark that other veterans noticed without needing explanation. Later that night, a man in his 40s sat in an exam room, hands trembling, eyes fixed on a spot above the door. His chart said veteran. His jaw clenched whenever anyone moved too quickly. Claire entered and spoke calmly. "I'm Claire. I'm going to check your blood pressure." The man's eyes dropped to the pin. His shoulders loosened almost imperceptibly. "You get it," he said. Claire nodded once. "Tell me what's happening." He swallowed hard. "I can't stop hearing it." Claire's voice stayed steady. "Then we'll slow everything down." In the pediatric wing, Gunnar walked the halls in a different vest. The vest was lighter. The patch read therapy. He had been evaluated, trained for this new role, and he wore it with the same discipline he had worn his old mission. He moved calmly, stopping when told, sitting when asked, offering his presence without demand. A little boy with a cast and watery eyes reached toward Gunnar with cautious fingers. Gunnar sat and waited, head slightly lowered. The boy's hand touched fur. The boy's breathing slowed. Claire watched from the doorway, hands in her pockets. Holt stood nearby, no longer in the hospital as a problem, but as a visitor, checking on the general and the dog and the program he had indirectly forced into existence. Holt glanced at Claire. "He's good at this." Claire's voice stayed quiet. "He was always good." The mission changed. Holt nodded once, understanding more than he said. "So did yours." Claire looked at Gunnar, then at the boy. "It didn't change," she said. It widened. Holt's mouth tightened into something that might have been a smile if he allowed it. "Fair." In the hospital auditorium, General Rourke stood at a podium, fully recovered enough to fill the room with his voice again. He spoke to donors and staff and veteran leaders. He did not sell gratitude. He demanded action. Claire stood at the back, not hiding, not seeking the front. Tina stood beside her, arms folded, eyes sharp as always. When applause came, Claire did not clap loudly. She simply watched the faces. Veterans who looked less guarded than they had looked before. Nurses who looked more confident in their ability to handle what used to scare them. After the event, Rourke approached Claire with his cane tucked under his arm, posture still strong. "They kept you," he said. Claire met his gaze. "They rebuilt." Rourke nodded. "Good." Gunnar walked up and sat beside Claire without being asked. His head leaned lightly against her leg for one brief moment, then lifted again, ready present. A nurse passing in the hallway paused to watch them. Not with fear now, with curiosity softened into respect. The hospital kept moving. Monitors beeped. Overhead pages called for rapid response teams. Gurneys rolled across tile. The work continued, patient after patient, decision after decision, without banners. On a late shift, as the ER quieted for a rare moment, Claire stood at the nurse's station charting. Jamal walked up and set a coffee beside her. "You're still impossible to read," he said. Claire did not look up at first. "You're still loud." Jamal laughed quietly. "True." He leaned closer. "You miss it." Claire's fingers paused on the keyboard. "Miss what?" Jamal nodded toward the hallway, the controlled chaos, the movement that never stopped. "The edge." Claire stared at the screen for a moment, then looked past it to the ER doors. "I don't miss war," she said. "I miss clarity." Jamal nodded slowly, as if that made perfect sense. Tina's voice cut in from behind them. "Room 3 is crashing." Claire's chair slid back. She stood instantly, already moving. Gunnar rose from where he had been lying near the corner and matched her step until she held up a hand. "Stay," Claire said. Gunnar stayed. Claire walked into room 3, gloves snapping on, voice steady as she spoke to the team. The rhythm returned not because of adrenaline, but because she knew what to do. Outside the room, Gunnar lay down again, head up, listening, ready to be calm when calm was needed. And in the white light of Crescent Valley's hallway, the hospital felt less like a place that punished what it did not understand, and more like a place learning in real time how to hold the people who carried the hard skills no one wanted to need until the moment they did.